فلا تنسى إلا ما شاء الله إنه يعلم الجهر وما يخفى ونيسرك لليسرى فذكر إن نفعت الذكرى سيذكر من يخشى ويتجنبها الأشقى الذي يصلى النار الكبرى ثم لا يموت فيها ولا يحيا قد أفلح من تزكى وذكر اسم ربه فصلى بل تؤثرون الحياة الدنيا والآخرة خير وابقى إن هذا لفي الصحف الأولى صحف إبراهيم وموسى. The translation of the verses I've recited before you is as follows. I seek refuge with Allah from Satan the accursed. In the name of Allah, the gracious, the merciful. Glorify the name of thy Lord, the Most High, who creates and perfects, and who designs and guides, and who brings forth the pasturage, then turns it black, rotten rubbish. We shall teach thee the Quran, and thou shalt forget it not, except as Allah wills. Surely He knows what is open and what is hidden, and we shall facilitate for thee every facility. So go on reminding, surely reminding is profitable. He who fears will soon heed, but the reprobate will turn aside from it. He who is to enter the great fire, then he will neither die therein nor live. Verily, the truly prosperous, verily, he truly prospers who purifies himself and remembers the name of his Lord and offer prayers. But you prefer the life of this world, whereas the hereafter is better and more lasting. This indeed is what is taught in the former scriptures, the scriptures of Abraham and Moses. Jazakallah.
Jazakumullah. I want to welcome Naib Ameer Sahib to our session here. Faheem, Younus, Qureshi, Sahib. The Naib Ameer Sahib is also Chief of Infectious Disease at the University of Maryland. And I'm very grateful that he's here with us on Saturday evening. We know he's very busy with his schedule. The whole idea of this session, I'll let Naib Ameer Sahib take over, but the idea is to ask questions about COVID-19 and related to that. Najiba, do you have any ground rules that we should set before we get started?
So just in regards to ground rules, I'll just go over again. I know many people have attended the sessions throughout, but I'll just quickly go over the process of asking questions just so there's no confusion when we come up. So for anybody who's a participant, we'll be prioritizing the questions that will come in via raised hands. If you have another question, you can send it via the chat box to the MKUSA host account as well, and we'll see them there. But again, we're prioritizing the questions that are coming in via raised hands. So the process for asking a question is you'll click the option for participants. It's on the left-hand side of your toolbar at the bottom. And then on the right side, there'll be a hand raised, and you'll click it and it'll put your name to the top of the list. We'll call on people accordingly as we go out throughout the process and until we can go ahead and get started. Naib Ameer Sahib, would you prefer that we call on the people to ask the questions, or would you like to call on people?
I think it's better if you help me facilitate that process. So you call on and just let me know.
So, Naib said that's the only instructions I have. Jazakallah again for coming and joining us. And so I'll just hand it over to Sahib.
Assalamu alaikum warahmatullahi wabarakatuh. Bismillahir Rahmanir Rahim. I'd love to take your questions. I personally think I'll gain more out of this session than you will, because for the past 4 or 6 weeks, maybe 8, I've been completely absorbed in the COVID work at my hospital. Those of you who may not know, I've training infectious diseases. I've dealt with Ebola or the post 9/11 anthrax or H1N1 and all other kinds of viral infections in my career. Up until 2-3 years ago, people would sometimes ask me, what does an infectious disease doctor really do? Why did you go into this boring specialty? Is it really a specialty or is something made up? So I was just telling my children that I see God's hand in a lot of things over the past 4 or 5 weeks personally, and it's more exciting than it's depressing. Of course, this is a trial. Of course, it moves you towards istighfar, but it has not moved me towards despair at any point. But with those quick opening comments, Mohtam Sahib, let's get to questions, and the more questions we can answer, the better.
Inshallah, so we'll go ahead and get started. So we'll again come to the questions from the top of the list, and we'll inshallah just take them as they come. So the first question comes from Shazib's iPhone. Shazib, bhai, I'm going to unmute you now. So you can go ahead and ask your question. So Shazib bhai isn't going to, we'll go to the next person. Safir bhai, I'm going to unmute you. You can ask your question.
Assalamu alaikum, this is Safir Bhatti.
Wa alaikum assalam, sir.
I just a quick question. So I wanted to ask about if you can describe the science behind of how this disease is spreading, the difference between this disease and other diseases that we've had, and like in examples like in New York, why is it spreading so fast there, and now it's sort of not as fast at other places? If you can describe that, Jazakallah.
Great question, big broad question. So this is typically coronaviruses were discovered in 1960s, and they exist in animal kingdom. They're not human viruses to begin with. But every now and then, every decade or so, one of these viruses hits the lottery and is able to jump from the animal kingdom into humans. 6 coronaviruses had done it already over the past 60, 70 years, SARS being one of them, Middle Eastern Respiratory Syndrome, MERS being another one. So this time we believe somewhere around November or December, this virus jumped from bats into humans in Wuhan, China. And it's very difficult. If you come in my specialty, it's very difficult to identify a novel agent, because that's not what you're suspecting. You don't go to work thinking, I'm going to see a pandemic today. So it took them 3, 4, 5 weeks before they started seeing a lot of these similar sort of infections that no test was coming back positive. And you knew it was an infection, and that's how it was discovered. Why New York? So the virus is, we call an RO. How many infections will the virus cause? If I have the infection and you're around me, how many more people am I likely to give it to? Influenza virus typically goes to 1.5 or 2 people. If I have it, I'm going to pass it on to, if 10 people have influenza, they're likely to pass it on to 15 or 20 people. This virus has almost the double rate of transmissibility. So it's very efficient, which means if 10 people have this virus, 20 or 30 people are going to catch it. And you do that math, you multiply it 10 times, that number is going to jump into the thousands. Now, many of us who go to New York City, or Wuhan, by the way, Wuhan has 11 million people in China. New York City has 8 million. England, all these large cities. What's common in large cities? Density. You know, what you have is, you have concerts, you have ball games, you have malls, you have crowds, you have people on subways. So there's human to human interaction. People are nearby. You have a very smart, very efficient virus that's going to go from one person to another. You have people who are vacationing, who are just going to try to tough it out, even if I have a cough or a sneeze. I was planning this vacation in New York for 6 months. I'm not going to be a crybaby. I'm just going to go and still enjoy my day in Times Square. So you get the point. I think that's how the virus has become so efficient, and that's why you see high numbers in some of these urban areas.
Exactly. So we'll move to the next question. And another quick note, I forgot to mention this. If the person who's asking the question wants to turn on their video, we'll give you the option. It'll pop up so we can see you, build that brotherhood, that connection. But again, it's advised that just be cognizant of the fact of who's in your camera screen or what the pictures behind you are. So you'll have the option. If you're not in a place where you can turn it on, just don't turn your camera on. So inshallah, we'll keep going. So next we'll come to the question of Ahmed Tariq Bhai. Ahmed Tariq Bhai, I'm going to unmute you.
Assalamualaikum, can you hear me?
Walaikum assalam. Yes, sir. Go ahead.
So the question is about the homeopathy medicine that was prescribed by the Jamaat. So the liquid version does have alcohol in it, as homeopathy medicine usually does, and it's not necessarily being prepared in like a very controlled environment. So I was asking, is it appropriate for pregnant women to take the medicine? Is there any harm to the fetus? Specifically relating to the risk of the alcohol passing through.
Excellent question. Honestly, I don't know, because no control trials, to the best of my knowledge, have been conducted. And this is the most frustrating part of this pandemic, because a lot of stuff is new to us. A lot of data does not exist. So I always resist the temptation to just wing it and make up some answer. My honest answer is I don't know.
Jazakallah. So we'll go to the next question. The next question will come to Salam Bhatti. Salam, I'm going to turn your video on and unmute you.
I feel like I'm in my basement, all these familiar names and faces. Every night.
I remember your basement very well.
Yes, sir. Assalamu alaikum.
Walaikum assalam. Jazakallah so much for taking time out of your schedule to be here with us. So there's so much misinformation out there. And at this point, I'm not sure what is the accurate information. So can you clarify whether projections out there are being blown out of proportion, whether this hydroxychloroquine zinc concoction is an actual thing? Those two questions, and any other misinformation out there that we should be clear on.
Excellent point. So they say misinformation is the vacuum. And this disease has left a lot of vacuum of information. A quick background, those of you who may have seen me on Twitter, the reason behind that was that friends and family and Jamaat member and co-workers were sending me so many questions and zinc-related myths, you already got my answer there, that it was impossible for me to get back to them. And I was feeling really bad and really guilty. And one day I was talking to my children in the living room, and one of my children said, Baba, why don't you just tweet these answers away so at least your guilt will go away. So that's how, honestly, I got on Twitter for this whole thing, because I was feeling guilty that I could not get back to people. So the reality, Salam Bhai, is that, so these are two different things. Hydroxychloroquine is a medication, is a prescription medication. Zinc is over the counter. So far, we don't have what we call randomized control trials, in which we have a control group and we have a treatment group, and we can truly attribute the results to the treatment. We don't have a control trial on hydroxychloroquine, on Actemra, on ivermectin, on Zithromax, on any of these drugs, remdesivir. So all we have is a clinical studies, which mean 30 patients, 40 patients, 50 patients treated with that drug and some outcomes. And the skeptical scientists would say, well, how do you know these patients got better because of that drug or hydroxychloroquine? How do you know that they were not just going to get better in 2 weeks anyway? And that's a valid question. You can only know that when you have two groups. So you divide 100 patients into 50 who receive hydroxychloroquine, the other 50 who are comparable. Their disease is comparable, but you give them a sugar pill. And then you see which groups does well. So we don't have those studies on zinc or on hydroxychloroquine or anything. So to be a purist, right now, I would say we don't know. They probably don't do any good. Where it gets even more complex, there are many diseases like SLE or rheumatoid arthritis or many autoimmune diseases where the advantage of hydroxychloroquine is proven, has been tested in randomized studies. The fear we have, if people start taking hydroxychloroquine just to prevent COVID, where there is no proven efficiency, All those patients who are, by the way, in millions, who are on these drugs for proven reasons, established reasons, we may run out of drug, and those people may suffer because now we don't have enough medication for them. So it's a tight balancing act, but I would say the treatments that you are hearing, and I'll start with myself, all the medical treatments as well. Everything is either experimental, best case scenario, it's experimental, worst case scenario, it's a myth. So in this particular situation, to wrap up, hydroxychloroquine is an experimental treatment. Zinc is a myth.
So come to the next question. Javed Iqbal Sahib, I'm going to turn your video on and unmute you.
Assalamu alaikum.
Walaikum.
I am Javed Iqbal from Harrisonburg, Richmond Jamaat. Unfortunately, I am affected with this COVID-19. So I am using beloved Hasur, which one that they recommend homeopathic medicine. I am using medicine. So thanks God, I feel better. I'm feeling better, and I want to know, is there any special treatment or special medicine? I hear that Islam Bhai already you discussed already about the medicine we don't have solid. So what do you recommend me to do?
Excellent point. So first of all, I'd like to say, may Allah Ta'ala save you, protect you, grant you a long, healthy, fruitful life. Since you're taking a recommended medicine by Khalifatul Masih, it may be good to write a letter to him and let him know that by the grace of Allah, you're doing well. As far as, so the second point is, I hesitate to give personal clinical advice to people. I think that's not how we should practice medicine. I discourage that. So whatever your doctors are telling you, Javed Sahib, I think you should do that. I can talk in generalities and still answer your question. By the grace of Allah, the way you are sounding, so you are under the age of 40, you're sounding pretty comfortable, you're not breathless, if you're not having fever, there's a 98 to 99% chance that inshallah you're gonna do great. Those are your odds, those are your chances. And with every passing day of the illness, by the grace of Allah, you are getting out of the woods. If this, in fact, particularly after day 10. So if it has been 10 days for you where you were sick, or if the fever has broken and it's been 3 days after fever breaks, chances are you're gonna be fine, inshallah. So no need for medications, no need for doing anything else, just control your fever, get good sleep. You can take steam inhalation or Vicks or anything else, which we call symptomatic relief. So there is a difference between treatment and symptomatic relief. When you take Tylenol or Motrin, it does not do, we don't know, but as far as we know, it may not kill the virus, but it helps you control the body aches, it controls the fever. So that's symptomatic treatment. So I'd encourage you to continue to take symptomatic treatment, pray to Allah Ta'ala, do good works, sleep well, actually also practice some digital disconnect. This is my anecdotal advice. Again, this is not studied and proven, but I always tell people it's best to take some break from your devices and truly let your brain and your body rest and reset. May Allah Ta'ala be with you. 98 to 99% statistical chances that you're gonna do great.
So next
one more thing before I go, Javed Sahib, I'm not seeing your picture. So next time we see each other at a jalsa or somewhere, you gotta come to me, give me a hug and tell me that you are that person. I'll be thinking about you.
Just one quick question for you too. Are you comfortable, and I'm sure you are, but is it okay for questions to come in Urdu as well for those people who aren't as comfortable?
Whatever Sadhu Sahib is comfortable with, I'm good with that. And I can always translate it in English for everybody else.
So as long as you're okay with that, we can take it.
That's fine. G.
Okay, take it. So we'll come to the next question. The question goes from Shazeb's iPhone. I'm going to turn your video on and unmute you. Okay, so if not, we'll go to the next person. The next one is Sahib Avan. And Ajlasab, I'm going to turn your video on and unmute you. Naib, your audio doesn't seem to be working. Go ahead and unmute yourself again. It's not working. Raheel can help you fix it until, and we'll just come back to you in a second. So go to the next question from Azad Avan. Azad, hi, I'm gonna unmute you and turn your video on.
Assalamu alaikum.
Islam.
I heard the questions about the chloroquine. So the answer was, we don't know, and then there's the unintended effects on the patients because it is already used for many patients. So I'm sure there will be a data how much it is being produced in the world and who are the patients which they must use versus the COVID-19 patient. I was reading a literature where it shows that it functions effectively and increase the pH of the cell, and the basic condition catastrophically kill or make it collidely unstable COVID-19 virus. Would you please comment on that?
Jazakallah. So hydroxychloroquine, the data goes back to 1980s actually in our textbooks. It's a very long conversation about its varying effects. Of course, it's a malaria drug to begin with. It should not be used, common sense tells us why would it be helpful for SLE and rheumatoid arthritis. It's precisely for those properties. Most people in the infectious disease community believe that it helps at the level and prevents the virus to attach with the alveoli. The problem is we see a lot of stuff which is in vitro, meaning it happens in the test tube, but unless it gets replicated in human beings, it's very hard to make a point that it truly works. And sometimes that data replicates in the human beings, and sometimes for whatever reasons, it does not. So what you're saying, there's a lot of in vitro, in test tube data on the drug. We still don't know precisely whether it will work for COVID-19 or not in humans. So that's the missing link. And the current editorial came out in Annals of Internal Medicine, one of the top 5 journals in medicines, I would say. And they recommended the exact same thing, that it should be used very selectively and not liberally, because then we will deplete the proven use of this drug for other diseases.
So we'll go to the next question. The question from H. Shakur. I'm going to give you the option to turn your video on and then unmute you.
Assalamu alaikum, Naib, Sahib, and everybody else. My question to you is, when you go to hospital or when you go to see patients, what protective measures do you take to protect yourself?
Jazakallah, it's called PPE, personal protective equipment. So most doctors would wear an N95 mask, which looks like this. So they will wear the mask, and then they will have gloves, and then they'll wear a gown, and sometimes they may wear a head cover. For me, because I have a beard, N95 does not work with facial hair because it does not give you a tight seal. So if I put a mask on, the virus or the air can leak from here. So we have a hood, which is a pretty big, it's called a papper. So I wear a papper on my head and my face, which gives me negative pressure. And then I wear a gown and gloves. And there's a whole process of hand washing and making sure that you protect yourself. The whole process actually takes a few minutes before I can go into a room. The other day, one of my nurses took a picture. I'm happy to share that with you so you can see the visual. But all of that is just tying the camel's foot, the camel's knee. In the end, we do what we have to do. I think we follow the science. We must follow the data. But at the end of the day, you just put it in, after doing all of that, the right things, then you put it in Allah's hand and just move on.
So we'll come to the next question. Adnan Aslam Saab, I'm going to unmute you and give you the option to turn your video on.
Assalamu alaikum. Assalamu alaikum. Well, I am an old maxillofacial surgeon, so I have been assigned duties to talk to dentists to stop treating their patients in the clinic in Pakistan. And there were a couple of queries that I actually wanted to address to them. And the one was that is repeated exposure and the amount of exposure that you would get, would that make you more liable to becoming infected with it or possibly getting severe disease? For example, getting this out of a community, would that be any lesser than getting it at the hospital or, right in front of a patient? That's the first question. And the second question is that nasal swab versus a nasopharyngeal swab. Is there a difference? I'm sorry, these are more possibly specific and technical questions, but I just wanted to have that clarified in my mind. And what's the accuracy of both of these? Thank you.
Sure. So appreciate both questions. So I think the issue is probably less between nasal and nasopharyngeal, but more nasopharyngeal and oral swab. So for those of us who may not be clinicians, a swab is like I was thinking, should I go and grab a Q-tip? You all can see it's like a long Q-tip. A nasal swab is that goes just up until here and we collect the sample. That's typically for bacteria like Staph aureus. There is no need for nasal swabs, don't work for this coronavirus. That's not what we recommend. So either we recommend it's this long of a swab, so you put it through the nose into the pharynx. It feels like a brain biopsy if you ever get one. You will tear up, it'll hurt a little bit. But you put it back and then you bring it. And actually it's when you're pulling it out, that's when it truly grabs the virus. So that's a nasopharyngeal swab. Second is an oral swab where you take the same swab and go into the mouth behind the pharyngeal wall of the patient. CDC recommends that both of them have equal efficacy, equal sensitivity, equal value. So if you have a choice between nasopharyngeal and oral, CDC would say that they are both comparable. The pure nasal swab is a no-no. Don't do that. Your second question is a harder question because we don't know the answer to that. It's a fantastic question, actually. That will repeat exposures make you sicker? Will you have a sicker disease? And this is what we are not measuring right now. So there are two ways to measure disease. One is how many people got it. So you measure how much virus is in the community. But then there's a second aspect which nobody's talking about, which is how much virus is in one person. For example, when we diagnose someone with HIV, we do a qualitative test and a quantitative test. What that means is the first test tells you whether you have HIV or not. The second test tells you how much virus you have in your system. And I have seen people with the viral load of undetectable, meaning as close to zero as possible. And I've seen people, their viral load looks like the price of a mansion. It's like 5 million, 4 million viral load. So that's a massive range. So of course, patients who have undetectable viral load are going to do better. They're not going to transmit the virus to anyone versus someone who has 1 million viruses. That's the kind of data we don't have with COVID today. We don't know who's carrying 1 million virus in their cough and sneeze and who has just 5 viruses. And it'll be fantastic if we could get there. The third part of your question is, will repeated exposures or a hospital exposure versus a community exposure will cause a more severe disease? We don't know that, and my hunch is probably not. My hunch is once you get it, it's probably your own genetic variation, what we call a genetic heterogeneity, which is well known. The same virus will cause different disease in different people. If you look at enteroviruses, and those of you on the chat, please tell me if I'm getting too technical. I know this crowd, I love this crowd. You're all scientists, you all get it. So that's why I'm deliberately sharing a little bit more detail here, not dumbing it down perfectly. But if you think I'm getting too technical, just let me know. But I'm going to give you an example. Enteroviruses, the same virus in one person may coughing and sneezing, in another person may cause inflammation of meninges or meningitis, in the third person may cause a rash, in the fourth person may cause diarrhea, and in the fifth person may remain asymptomatic. Now that's not because of the virus, it's because genetic heterogeneity. 5 people have different genetic makeup and they react differently to the virus. So to answer your question again, I think the difference in our disease or our severity, my hunch is likely due to genetic heterogeneity rather than the degree of exposure. But to give you the absolute honest, that's just my hunch. We do not have a sure answer on that. I think inshallah there will be research on it. In a year or two, we will have those answers in a more data-driven form.
And then Rishabh, the question from Shadid's iPhone, I think he's having some technical difficulties. So we'll just take his question written.
Sure.
The question is, how many patients have you treated in the last 3 months with COVID-19? And what are the therapies that you are using when seeing patients in the ICU?
So in our hospital so far, I'm in the outskirts of Baltimore, and we are between, we are below the hurricane that's in New York, New Jersey right now, and there's another hurricane building up in Washington, D.C. So there are these hot spots of diseases. We're sandwiched, so this is New York, New Jersey, this is Washington, D.C. We're sandwiched right in the middle. So now we know it's coming to us. I would say the number of patients in our hospital have been less than 24 that have the disease. I have treated many, and then I have been involved indirectly in the care of almost all of them because of my position in the hospital and the policies that we're making. We do think that we are about 2 to 3 weeks before the peak. So there are many projection models that tell us when we should hit the peak. Baltimore, where I am, we feel like the models are saying end of April is when we should hit our peak. And there was a second part to the question, I forgot. So one was, the treatment modalities. So so the treatments we are doing, I think the good thing is 3 months ago, we had no idea what to do. We just had supportive treatment. So now at least we're using hydroxychloroquine. If we have younger patients who are not on too many other medications, we give them a combination of hydroxychloroquine and Zithromax. Then about day 7 to day 10, when some of these patients, a subgroup of them, may become very sick with what we call a cytokine storm. What that means is some of these younger patients, particularly, their own immune system starts fighting the virus to the point where the damage done by the immune system could be bigger than the virus itself. So you got to sort of calm that immune response down. And for that, we have some biological agents like Actemra. And then there are different ventilator settings. Something fascinating that we are learning is the same way, a month ago, what we thought the kind of disease the virus causes in the lung is sort of different than where we are today. So the use of ventilator early versus late versus the kind of settings we're using, they are different. So I, again, don't think we have anything conclusive. And anything I say on the call today, by the way, it's not a disclaimer. I'm not worried about being misquoted. I think it's important in the spirit of honesty that you should know that everything should change and will change. We are chasing a tornado right now. It's a fast moving tornado. And I tell my folks at the hospital, I don't want to be working in a hospital these days. I don't want to be working with a team these days. That's not changing because they're sitting ducks. They're gonna get hit by this tornado. I think it's important for us to remain agile, for us to remain humble in our minds, for us to keep an open mind and change according to the data. So a month from now, if we're having this conversation again, some of what I'm telling you today may change. And that's a good thing. That means new information has come and we are open-minded and we are not stuck to our own opinion. We're doing the best for our patients. So those are some of the treatments that we're doing today. Many of them are experimental, and whether they work or not, we will find out down the road.
And just as a quick note to everybody who's asking questions, I think there's a long list. If you get a request from us that says to turn your video on, that means you're next in line for a question. So just be prepared to ask the question then. So next we'll come to Ahmed Tariq Bhai. Ahmed Tariq Bhai, I'm going to unmute you.
Jazakallah. So my next question is that in Korea, there have been, and in some other places, there have been instances, more than 80 of them, where people who were previously tested positive and then tested negative, and now all of a sudden are testing positive again, either because they got reinfected or reignited. So I guess my question is, why would antibodies not be forming in either of the case of reinfection or reignition?
Fantastic question. This one is easier than the homeopathy question in pregnancy you asked me, Ahmed Bhai, so I appreciate that. I think what I am trying to see, I have not found the literature on those 70 or 80 patients. I've read news stories, I've seen the composite number, but I'm very anxious and interested and curious to read about what happened to each case, or even few of those cases. So if you have that information somewhere, do send me an email, because I'm interested in that. And here is why. Just merely culturing the virus again or having a DNA PCR positive again does not mean that you have the disease again. We see it in TB all the time, for example, where we will do what we call AFB stains on the sputum. Tuberculosis is another lung disease. And typically once we put somebody on treatment, 2 weeks, 3 weeks later, their sputum should be negative. But we see it quite often where 2 months later, sometimes, I have patients 3 months later, they're getting better, their fever is gone, they're not coughing, they're gaining weight, but their sputum continues to show the bacteria. Now, we understand in our infectious disease community that those are dead bacteria, they're not causing the disease anymore, and they will not communicate the disease anymore. So we believe that patient is healthy and that patient is not contagious. However, you continue to see that dead bacteria. There are other similar diseases where we will see the DNA, even though it's dead DNA and it's not contagious. So that's my first hunch. To answer your question, we don't know, but here are my views on it. Number one, I will be very surprised if people are getting reinfected. I think that's a stretch. That's a very difficult thing for me to believe unless I see hard data. So I will be tempted to see, are these patients sick as well, or they just got a surveillance test? Because if they're not sick, that positivity does not bother me at all. I can explain it in different ways. If somebody is truly sick and they have a positive test, that's the case study I want to read, because I want to see then what happened the first time, how sick they are the second time, and we need to look at a lot of other data points. But to wrap it up, I think most patients who get this infection, and after 10, 14, 20 days, once they get better, chances are they're immune, chances are they're not going to get reinfected in the same season.
So next we'll come to Sayyid Mahmood. Sayyid Mahmood, I'm going to unmute you.
Assalamu alaikum wa rahmatullahi wa barakatuh. Faheem, Younus, Sahib. I'm really happy to talk with you. My question is regarding the usage of the mask. We have different type of mask in the market, some called surgical mask and N95, and then there is the mask, I don't know its name, but the one which you had with you. In our office, they call it like it's just a simple dust mask. So my question is how effective these masks are, because there is so much different kind of opinions are going around in television also. Some says it's good to wear it, some says we suggest it, but we cannot make it obligatory. And the second component is these masks, which there is a drive of making homemade kind of masks, how effective those are. And the last one is regarding if someone has a beard, then what kind of mask is best for them, or it's always a kind of risk even wearing the usual mask. Jazakallah.
Jazakallah, Mahmood Saab. First of all, my apologies. I saw your missed call earlier today. It was after many weeks that I got a chance, so I was calling all my elders in the family overseas and just saying salam to them. So I could not take your call at that time. Your question about masks, first of all, agreed. It is a controversial issue. There are two views on it, so I want to acknowledge that. Second, I think this is the mask that we recommend when people go in the public. I think sooner or later this will become a recommendation. I wrote a piece about it in 2011 when H1N1 came out, because when you see the nations like Hong Kong, China, Taiwan, Singapore, where they've had these outbreaks, you'll see after an outbreak is completing, people are wearing these masks in the public. It's called an ear loop mask. So you put it around your ear, you put it over your nose, and that's the mask. And this is the advantage of this mask is, as you can see, I can still speak, you can still hear me, but this is a barrier between me and people around me. This mask is likely to protect people around me more than myself. And let me explain why. We believe up to 25%, and that's a very large number, to 25% patients with COVID may have very mild symptoms or no symptoms at all. So if I'm one of those 25% of the patients and I'm coming to work, I don't have fever, you don't think I'm sick, I may have a little bit runny nose, people think I have allergies. When I cough or sneeze, I may communicate that virus. If I'm wearing this mask, the chances of me throwing those droplets out in the environment are significantly reduced. So people around me are protected. Nothing is 100%. This is not going to protect people 100%, but it will greatly reduce the degree of that droplet spread. If people around me are sick, what if my other coworker is sick and he does not have a mask on and he's coughing and sneezing? Chances are I will still inhale it. So this mask may protect me less from others, but may protect others more. That's important to remember. So when you wear this mask, think of it as service to humanity, not as service to yourself, number one. The other mask is the N95, as I said. Currently so this is the mask. It's called N95. It's bulging like this. It's designed to filter out 95% of this virus from the environment. Right now, there is significant shortage of N95. So we're not recommending general public to start buying or hoarding or start using N95s, even though I believe they're better. But once again, with the facial here, we don't know if they're really that good because they don't give you a tight seal. Third part of your question is about homemade masks. And yes, CDC has a very good link about it. If you just Google CDC homemade mask, they tell you what kind of fabric to use, how many layers, how to create a mask at home. And if the idea and intention is to protect others, I believe that mask should be just as good. I will take this opportunity to let everyone know that please, there is no way for you to remain myth-free, rumor-free, unless you continue to get your advice from reputable sources. I would say cdc.gov.gov. They have all kinds of FAQs. They have all kinds of information for patients, for doctors, for healthcare providers, for hospitals and systems. So it's a very heavy site. There's a lot of information. It's very dense, but still I think that's where the science is. Please don't confuse news stories as scientific information, because news stories is not always science. And as far as the spiritual angle is concerned, I think it's unbelievable, because what I'm seeing in the world today, whether it's hospital systems, whether it's states versus countries, whether it's countries versus countries, the biggest challenge is for people to align behind one theory. Because there's so much gaps in knowledge, it generates 100 different opinions. Everybody's struggling with it. But when I see Hazrat Sahib speak, and when I see the alignment within Jamaat, when people will look back at this, they will be amazed as to how quickly this global community could unite behind something. And I think it's really important for me to mention it here, because masks is one of those discussions where even the scientific community is not united, even though we believe it's a pretty straightforward issue. I hope I answered your question.
Next we'll come to a question from Aleem bhai, I'm going to unmute you.
Assalamu alaikum, Naib Ameer Sahib. There's alhamdulillah a lot of social and physical distancing happening right now. My question is, how do we get to a point where we can basically open up again? What will it take? When I see that vaccines seems like they're a long ways away, and then I hear the option of herd immunity, and that sounds really scary to me because of the potential loss of lives. So what will it take for us to be able to get to some semblance of normal? I know normal will change, but where do we get to?
Allah knows best. Very difficult. They say it's very difficult to make predictions, particularly about the future. I will start by a global concept. Allah Ta'ala says in Holy Quran, "Inna ma'al usri yusra, inna ma'al usri yusra." There is ease after hardship. Surely there is ease after hardship. I think that's a very important point to remember these days. Otherwise, we'll get bored and depressed and ungrateful and a whole lot of other things. So that's the holistic angle of it. I think it's very important. Civilization will still be standing. Mankind will, inshallah, still be standing. And Jamaat and Khilafat will still be standing. So just rest assured. Because I know this is an anxiety-provoking question, and many of us think about it, if not all of us. So I agree with the depth of the question. It's multidimensional, though. It depends on so many factors. If I asked anyone, how do you think that the stock market will be doing in 6 months? People will laugh at me. Because after repeated discussions, this has been hardwired into the American psyche that you cannot time the stock market, correct? And because stock market is complex, it's based on so many different variables. This is probably more complex than stock market. So I'll tell you the factors. I cannot tell you when it gets to normalcy, but here are the factors. Number one, how we react to it. Is our social distancing really global social distancing, or are we just doing it in the policy and not in practice? There are some watchdog organizations that have started measuring the degree of social distancing and giving every county a grade. I think it's called Unicast, U-N-A-C-A-S-T. If you go online, you can look at it. You can see the grade of your county. What they're doing is they're looking at cell phone data, and they're seeing how much traffic has gone down, where people are. So my county, for example, where I live, we get a C grade. That's average. Now that's exactly what the virus wants. The virus loves that we are not unified, number one. So how good is our social distancing? Number two is other environmental factors which may change this virus. We don't know that. How will global transportation increase or decrease? About 4 billion people travel across the globe every year now through airplanes. You see all those airplanes are grounded now. What will be the impact of the lack of that global travel? Likely positive. Number three, awareness, treatments. How effective these treatments are going to be. Will one of our experimental treatment just all of a sudden take off and starts killing the virus? Number four, even on the vaccine, we in the medical infectious disease community are hearing different numbers. There are some scientists and labs in UK that are projecting that their vaccine could be out in 6 to 9 months. Most of the US labs are saying 12 to 18 months. Number five, when you talk of things like 12 to 18 months, don't forget, every winter, what do we have? Influenza and other viruses, rhinovirus and adenovirus and other coronaviruses. So what will be the impact when this virus, when this storm blends into another storm this December? We don't know whether there will be a positive impact, negative impact. Number seven, how much PPE or personal protection equipment we will have moving forward. As a nation, will we deplete our supply where we will not be left with masks and gowns and people will be reusing them for months? Or will we have tons of it so our front line can be fully protected? And that's where we break the chain of this virus. Number 7 or 8, I've lost count, but I think those are the factors. With every passing day, more and more people are recovering. Right now, the global number stands around 1.7 million cases. Nearly 300,000 to 400,000 people have fully recovered and in my opinion are likely immune. So when that number increases here in the US and in the globe, every time the virus comes across one of those people, that's where the chain breaks. And I know that's the whole concept of natural herd immunity. So it depends on a lot of those variables. What we know, however, that the early time where you could stem this fire in the early stages, that opportunity we lost. I typically say that football games are decided in the fourth quarter, pandemics are decided in the first quarter. And we had a terrible first quarter. We all know that. We did not have enough tests. We did not have enough PPE. We did not have early recognition and early warning systems. So now we are in what we call a mitigation phase. This will likely, short of divine intervention, Allah Ta'ala can do anything. We believe the direct medical impact and containment of this pandemic is a matter of months. It's not a matter of days and weeks. The ripple effect impact, the unemployment impact, as well as the economic or social impact, the impact on social norms and the recreation and rebuilding of systems is a matter of years. That will continue for years. But I just want to make sure, once again, there is ease after hardship. Surely there is ease after hardship. They say that every crisis has an opportunity. And I keep wondering that as a global spiritual movement, what is that opportunity in this crisis for us as Ahmadis? And I pray to Allah Ta'ala that inshallah Ta'ala, through Hazrat Sahib's words, we are going to hear that opportunity. We're already hearing, Hazur is reminding us about istighfar and about helping others and about not judging people. So how many opportunities are going to come out of this crisis for us? I think that's how I would want everyone to think about it. That as far as we are in it, as far as that end game doesn't happen, please don't look at it as a wasted time. This is not time wasted. It's up to us. How we reflect during that time, how we reconfigure our priorities, and how we come out of it prepared. We hit the ground running and find out that opportunity that's hidden in this crisis for us.
As you were answering that question, my dad actually, I guess he Googled the score in my community and he texted that to me. We got D+, so that's a bad thing.
Oh, I feel better all of a sudden.
So next we'll come to the question from Naib, the one he tried to ask earlier. Naib writes, unfortunately, we are seeing some Ahmadis getting ill and some even dying. And this question is not only relevant in the current pandemic. My question is that, God forbid, if an Ahmadi has loved ones on the ventilator and there is a low chance of cure, what is Islamic teachings around withdrawing care?
That's a very difficult question. What I have heard from Hazrat Khalifatul Masih in one of the question answers, that Hazur said, try it for a few days, and if then there is futility, then don't prolong. So I'll just leave it at that. I think it's a deeply ethical, difficult, personal question that is loaded with dimensions that are beyond me right now, because it's not all rational. Both of my parents went through that stage, and I have my own deep personal experiences. I don't want to bias anyone, but that's why I just said that I heard it from Hazrat Sahib. I can't tell you exactly which question answer session it was. So rest is a conversation with the patient's wishes, with the wishes of the family members that the patient allows. It also depends on scarcity of resources. Where we are going in our hospitals these days, we are already planning for a situation where what if we have 4 patients and only 1 ventilator? Who will get that ventilator? And this goes back to the utilitarian conversations as to where is the greater good. I know I'm not giving you a sharp answer, but there, in my opinion, there is no sharper answer than either writing to Hazrat Khalifatul Masih or finding more question answer sessions from Hazrat Khalifatul Masih Rabi. I know that he also commented on this, but in my own profession, I can tell you that I've had these conversations with hundreds, if not thousands of patients and their families. Most of my patients, regardless of a pandemic, are critically ill. They're in the ICU settings. And sometimes I'm the first one initiating that conversation because people have told them that this infection doctor can come and cure you. And I have to sit with them day one, and I look them in the eye and say, look, I know the doctor-patient relationship needs years. I don't have years. You're seeing me for the first time. And I got to tell you, there is a time to protect life, and then there is a time to protect someone's honor. this may be the time to protect the honor of your loved one, because he's on a ventilator for 45 days. His chances of making it through from this hospital as a meaningful recovery are less than 5%. Here is what he's likely to face. And families usually respond positively to that kind of honest yet compassionate discussion. And when they are struggling with the answer, I always ask them, would you like to live like this? And that makes it very clear for everyone.
Jazakallah Naib for that answer. Munawwar bhai, I'm going to unmute you and you can go ahead and ask your question.
Assalamu alaikum, Naib. How are you, sir?
Shukr, alhamdulillah.
Alhamdulillah, alhamdulillah. All right, so I get the how it could be transmitted from your cough. You know, it comes from your lungs. So when you cough and stuff, and you know, you go back behind and you touch, you know, it could be transmitted that way. The thing I'm not understanding is, in the beginning they were saying that it could be transmitted from touch also. How is that possible? Why was that precaution sent out before the coughing and it being airborne? And the other thing I wanted to know was, I'm hearing stuff about ibuprofen. Not taking ibuprofen while we're in this pandemic.
Good questions.
Those were my couple of questions.
So ibuprofen, I think, is a sort of a careless remark from the Ministry of Health of France, where based on some previous studies, they started saying that use of ibuprofen will exacerbate coronavirus and people should not take it. And to the best of my knowledge, WHO also endorsed it. However, we in the infectious disease community, having treated viruses for decades and having used ibuprofen or Tylenol indiscriminately, we knew that that was not the case. And then WHO retracted that position. And today, nobody will say that one is better than the other. If someone still wants to avoid ibuprofen, more power to you. I have no problem with that. But please don't tell others that this is going to harm you. So that's the ibuprofen issue. As far as the issue of touching versus sneezing versus coughing, I hope you don't mind. But I would say, let's think like the virus. That's how we can understand it. Let's say we are the virus, we are the coronavirus. And our mission is to get into someone else's lung, because that's the only way we get to live. Remember, this is going to take a longer time for this answer, but I think it's important because this is generating a lot of panic and hysteria for people. So I have to break it down. The virus only gets to live inside the human body. If it goes on a surface, it's a marked man, as you would say, a marked virus. Within minutes or hours at the most, it's going to disintegrate. It's a small part of protein, it's going to die. Just like a human being who does not know how to swim. If you're underwater, you have seconds. You know, you got to come out or you're dead. So the moment a virus is outside of human body, that's underwater for the virus. So understand that. For the virus, oxygen is all inside a human body. So that's the virus's mission. So if you're the virus, and this is some hypothetical you, not you or me. So the virus would want, the best strategy is, let someone cough, I'll get in the air, and somebody else will inhale, they'll open their mouth or nose, and I'll go in their body. Once the virus goes into someone's body, the chances are 98% of the people are going to live, and their immune system is going to be able to kill the virus within a week to 2 weeks. The virus has 2 weeks then to jump from that person to another person, or the virus is dead, right? So that's the strategy once again. So during those 2 weeks, the virus knows that I must start my cycle again into another human being, or this immune system is going to kill me within 14 days. The clock is ticking. Now, if you are that virus, do you want to go into another human being, or you want to go into the lung directly? You want to land here on the face? You want to land on someone's hand? You want to land on an Amazon package or a doorknob, right? Those are all the opportunities and options you have. I'd say that my first option would be to go directly into that other human being, right? That's how I get to live. So that's the highest level of exposure. We got to protect that. That's why I said masks. Do not allow the virus an exit from your face and an entry into someone else's airways. That's number one. Number two, if it lands on our face, right, again, a mask will protect that. Number three, if it lands on my hands, if you have the virus, I shake hands with you. That's why the first khutbah, I felt Hazrat Khalifatul Masih was talking like an infectious disease expert. He was spot on. Don't shake hands. World leaders were still shaking hands. So why Hazrat Sahib said that? If you have the virus, so if I'm infected, I'm poking and touching my face, the virus is on my hand, I shake your hand, it goes on your hand. Now you touch or poke your face somewhere, the virus gets in. That's why hand washing is very important. However, everything beyond that, coughing. So option number one for virus, the best option for virus is go directly in. Option two is land somewhere close to the face. So a casual hand touching will allow me access. Option three is, all right, get on someone's hand. So through casual contact, I'll go to the other person's hand and then into their system. Beyond that, as a virus, I have all horrible options. Those are all options underwater. I have very little time to survive and then find a host. So I don't want people to be scared of doorknobs. I don't want you to be scared of the steering wheel. I don't want you to be scared of food that you may just take out from a Chinese or any other Italian restaurant. I don't want you to be scared of delivery packages. Just wash your hands, that's it. It's very, very unlikely for a virus to survive on all of these surfaces and then be able to infect you. In a hospital setting, however, it's very different where I work because we have patients with COVID. They are there, we're doing procedures in them. Tons of virus is being aerosolized in the environment. So we have to be extremely vigilant to make sure all surfaces are clean. We have to extremely vigilant with what we wear and how frequently we clean the air and we clean ourselves. So long answer to your question, but to wrap it up, the priorities for the virus, what the virus loves is inhale first, face second, hands third, and after that, whether the surface is, whether that's my clothes or whether that's any other surface, is the virus's least likely option. And another important thing, because you could Google this, there was a Washington Post article about it. The dollar bills or the cards or the money that you have in your wallet, all kinds of bacteria have been cultured from that money because it goes from one hand to another. E. coli, Campylobacter, Acinetobacter, even cocaine traces have been found on dollar bills, multiple studies. When was the last time you got sick from your dollar bills? So I think I want to make my point that the detection of virus on a surface is one thing, but that existence of the virus on a surface, on a mechanical surface, versus that virus being able to cause a disease is two very different things. Don't become paranoid or don't let that stop you from living your life.
Dr. Naib, so next we'll come to the question from Ameer Qureshi.
So Sahib, how are we doing with time? Are we okay?
Naib Ameer Sahib, so we have you allotted till 9 o'clock. If whatever's best for you, if you want to cut it short before that, that's fine. Whatever.
As long as there are questions, I'll take care of all questions, inshallah.
Perfect. Jazakallah.
Assalamu alaikum. How are you?
Shukr, alhamdulillah.
Can you hear me?
Yes, sir.
So the question that I had was, is mainly on public policy. Like, what would be like public policies that if you were the president of the United States or of a major world or of a major world government, or if you were put in charge of emergency preparedness or response, what would be the steps that you would take to mitigate this disaster, or as they say, flatten the curve, and what would be the state's thing you would do right here, right now, in the state that everything is in, and going forward in the future, what preparedness steps, what preparedness? I think that's the right word. Steps would you take for another future pandemic going forward?
Excellent question. So I think this question varies depending upon which state you select, because I think my approach would be very different in resource limited countries like Bangladesh versus United States, number one. Number two, the second factor is, are you giving me that charge today, or are you giving me that charge a year in advance? So if you're giving me that charge in 2019, I'd like to start putting a system, because none of this comes as a surprise in the infectious disease community. We've always said jokingly in our doctor's lounge, when all the doctors are sitting and they're bragging about their specialty or they're bragging about their procedure, I've always joked with them. I said, guys, it's going to be a bug in the end that's going to end the world. You're not going to be important. Your procedure is not going to be important. So we always knew that this was the biggest threat. So I'd have a better stockpile of protective equipment. I'd have a better infrastructure in place, so I'm not caught off guard. I would not be doing the talking, by the way. I'd have all the experts come together, and the experts will simply be talking the science of it, and the government will be talking the social aspect of it. What social benefits, how we are going to reduce fear and anxiety among our people. How are we going to keep you safe and secure? I think if I'm the head of a country, even if I'm an infectious disease doctor, chances are I would not be talking about the science of it. I'll delegate to someone who's respected, who's nonpartisan. This is not a partisan issue. And I think the biggest opportunity for me will be to unify people. Because as long as the virus is more unified than us, I don't think we can win this war. Because today, you can see the virus is not distinguishing between rich and poor and black and white and Pakistani or non-Pakistani or a Muslim or non-Muslim. The virus is not asking these questions. The virus asks only one question: are you human? So we have to unite at the level of humanity. And right now, as you can see, this is no secret. You can just turn on any TV channel and you can see the divide between us. So I think the first burden of leadership is to create unity. And you create unity by data. You sometimes create unity by acknowledging your mistakes and taking responsibility, not blaming others. Now, coming to specifics, I just wrote an article today for resource limited countries. What some strategic steps you can take, and I can quickly go over it. Number one, you create safety. Your people must feel safe. They should not be afraid to get a test. Number two, you educate. You really use the media and you educate people what are the right things to do, because we don't have a vaccine, we don't have a treatment. The best thing we have is behavior. The best thing we have is how we react to it. Number three, I think you test. You create 100, 1,000, 5,000 testing centers all across the nation. And you tell people how they can get tested. And number four, you quarantine. When you find out someone who's positive, you test their family members, because the data says 10 to 15% of the family members will be positive. Then you go and check their friends. Number four, you go for a selective lockdown. I think a complete lockdown will be difficult and impractical after a while. So you will have to allow people to take common sense precautions, 6 feet away, wear masks, hand gels everywhere, hand hygiene, but the necessary parts of their life will have to start again. I'm not saying you open up schools, no concerts, no religious gatherings, no NBA, no NFL. Anything that gathers a crowd, you stop that. But you allow the banks to move on. You allow healthcare to move on. You allow some of the businesses to move on in a very, very careful, scripted, guarded way. And then you use technology. One of the biggest things is people want to help. And I think this is where humility comes in. Nobody knows everything. Stop acting like you know everything. You go out and tell people, hey, how can you help me? So use technology. there are 100 ways to use technology. I'm not going to go into all of that. But then ultimately, the bottom line is keep telling people that nobody will have 100% perfect decisions. No government, I believe, can make 100% perfect decision. No scientist has 100% perfect knowledge. But for us to unite behind an 80 or 90% perfect decision is the most important thing. And we need to understand that we are all in it together. I'm not saying we don't investigate. I'm not saying we don't try to find where things went wrong and who should be held accountable and responsible. All I'm saying is that's a 2021 conversation. The law of the situation demands that we first put the fire out. And once the fire is out, once the house is rebuilt and then life moves on, then we go back and we investigate, yes, what started the fire.
Jazakallah, Ameer. So next we'll come to the question from Shajeel Bhai. Shajeel Bhai, I'm going to unmute you and you can ask your question.
Assalamu alaikum, Naib Ameer Sahib. How are you?
Walaikum assalam.
Naib Ameer Sahib, so I've been in contact with multiple people who have tested positive, and it's now coming to my house, but I believe that I was the carrier bringing it into the house, but I have no symptoms and I also tested negative, and it's been less than 2 weeks since I've been in contact with all these people. So if a person is asymptomatic, this is again piggybacking on everybody's question, how long will the symptoms, or how long should I, what have I tested positive? How many days could it stay in my system? And the second thing is in regards to negatives. So tests that are coming back negatives, but they're actually, people actually have the virus in them. How are you guys seeing that in the USA or, you know, in your guys' region? So, because I believe it hard that all of my siblings have tested negative and my parents have tested positive when we've been in very close proximity of each other within the last 2 weeks.
Jazakallah for the question. So first of all, it's not beyond the realm of possibility that you are genuinely positive, negative. As I said earlier, we believe, you know, the common sense belief, because there's so much information to the degree of panic in the media, that people assume that if I have a family member who's positive, the whole family must be positive. That's not the case. The earlier studies from Wuhan, China, have shown that 10 to 15% of family members are positive. Singapore is a country of 5 to 6 million people. And last I checked, they did not have any healthcare workers exposed or catch it from the patients. And what is very interesting, how Singapore defined exposure, they said that unless you've spent time with a patient within 6 feet, number one, so there are 3 criteria. You must be close to the patient within 6 feet. Number 2, neither party should be wearing a mask like this. So the doctor is not wearing a mask, the patient's not wearing a mask. And number 3, that you should be within that proximity for 15 minutes. That's a very long time. 15 minutes within 6 feet without mask is a very long time. And with those criteria, they did not see a lot of conversion of people. So number one, all I'm saying is it's very likely and possible that you are genuinely negative and did not have the disease, number one. Number 2, within a couple of months, this is a good chance that we may have a serological test, an antibody test. And that test actually checks whether you were exposed to this virus. Whether you have an infection now, it tells you whether your body was exposed to it and does your immune system has a scar or antibodies that we can measure. So you will be able to get that test down the road. And if that test is also negative, that tells me that you are true negative.
And again, this is a reminder to everybody. I see that a lot of questions are coming in via the chat box. If you do want to ask your question, I recommend raising your hand. We'll come to the raised hands questions first, and then we'll move towards the chat box questions. So again, if you do have a question, just raise your hand. I think it'll be faster to get to your question. The next will come.
Can you get me a cup of water? That was just a joke.
I can keep on a text until he can bring it to you.
That was just a joke, sir.
Gotcha. So next we'll come to the question from Jazib Bhatti Sahib. Jazib bhai, I'm going to unmute you.
Assalamualaikum, Naib Ameer Sahib. This
is sir.
Hello. My question is hypertension a risk factor for COVID-19?
Yes, sir, it is.
Akala.
I just saw as people join in, the message popped up on my screen, TB joined the chat, scared the heck out of me. That's an airborne disease. I know, those are initials of one of my brothers, but.
So next we'll come to the question from Sahib Yusuf Sahib. Sahib, I'm going to unmute you.
Assalamu alaikum, Mohtaram Naib Ameer Sahib. कैसे हैं आप?
शुक्र अल्हम्दुलिल्लाह.
First of all, जज़ाकल्लाह, आपने अपने इतने कीमती वक्त से हमारे लिए कुछ टाइम निकाला. तो चूंकि पब्लिक प्लेटफॉर्म है तो मैं इंग्लिश में सवाल करूंगा इंशाल्लाह. I work in the public sector in wastewater treatment. I just haven't had the time because I've had to go to work every day and didn't have the time to read more about whether this virus is surviving in wastewater. So what is your thought on those who have this virus and they're discharging it in wastewater, and those public employees who are working? What kind of precautions would you suggest at the bare minimum?
Yeah, good question. So the research has shown the virus can be found in sewer and wastewater. The virus can be found in human excreta, even though it's not a fecal-oral virus. It's not like salmonella. It does not go from eating, but it is excreted in the bowel. So therefore, actually some studies are now saying that if you test the sewer of a city, it may be an early warning sign that as the sewer volumes of the virus go up, that means an outbreak is about to happen. So all of that is still in the hypothetical scenarios. But to answer your question, yes, water can be contaminated with this virus. As far as your precautions are concerned, I would strongly recommend that you follow the precautions that your institution is recommending you, because that depends on a lot of other factors. And there is so much information on this right now, and there's so much attention from the government that I would want you to trust the institution and run with their policies as to what you should do, whether you want to wear a glove or whatever precautions they tell you. I would suggest you do that.
Next one, Habib Saab. I'm going to unmute you.
Naib Ameer Sahib, also I wanted to say that if you want to take a break at any point, please do let us know. Don't feel pressure that we need to keep going.
Appreciate it. No, you can tell I'm loving it, because Allah knows I have been so burned out at work for the past 1 month. I haven't seen a desi, it feels like. So having all of you brothers around is energizing.
And no worries, Amir. I texted Sid waiting on his response. The water cup should be coming soon.
That's a good one.
You guys. So next, Samir, I'm going to unmute you. You can go ahead and ask your question.
Jazakallah. Assalamu alaikum wa rahmatullahi wa barakatuhu. Naib Ameer Saab.
Sir.
And Jazakallah Sadar Saab to giving us this opportunity to have him here live with us. My two questions is basically a question, but it concerns with two things. Like, I would like to know, is this the virus that stays in the air? And the second part, like we see some news and having some people like coughing or sneezing on the grocery shops and like fruits, vegetables, or any packed foods or anything like that, and we go and picked up. Even we don't know, even other workers or anyone don't know like what is going on. If they catch them, is fine. So is it any serious thing in there, like we can save ourselves from them? Like obviously we come and wash them, but we picking up wild grocery and all that stuff. So how it's going through? That's my question.
Yeah, earlier, so my short answer is please don't worry about it. That's not to say anything is 100% safe, but I think the risk is so minuscule and so unpredictable that there's not much you can do about it. We don't think that anyone who comes to us, the patients who come to us with COVID, no one tells us that, look, it's that grocery or it's that shipping package or it's that doorknob that gave it to me. Almost all our patients so far have a history of good exposure. I had a patient 2 weeks ago, actually, who called me and he said, I got tested positive. He's a good friend, he's a physician. And he went to a concert in New York City in the middle of it. And I asked him, when was the concert? He said, 10th of March. Imagine 10th of March and people were still attending concerts, thousands. And I asked him, I said, how many people were there at the concert? And he laughed, he said probably 25,000 people. So once again, I'll tell you, that's not the virus's strategy to try to survive on a vegetable. Now, again, because it's so difficult. I think my cup of water is here. Give me 1 second.
The door is locked, so I'm just going to have to go open it.
This is why I always love Khudam Lambiya. The genius ideas are always here in this majlis. So yes, I got a cup of water. Mohtam Sahib, you're fantastic. So please do not worry about it. If you must worry, just wear gloves before you bring those stuff home or wash your hands. When you cook those vegetables, that's the best way to disinfect it. The virus cannot stand that kind of temperature. So just wanted to make sure I reassure you. I also know that transmission, as I said, it's a very personal level. Some people, no matter how many reassurances you give them, they don't feel comfortable. If you're still not comfortable, I respect your choice.
And Ameer Sahib. So next we'll come to Usman Rana Sahib. Usman Rana Sahib, I'm going to unmute you.
Assalamu alaikum, can you hear me?
Yes, sir. Walaikum salam. Please go ahead.
I have a question about the BCG vaccination. I've read some studies from some really renowned institutions. They're saying that there are certain countries who use BCG vaccinations. The rate of mobility and mortality is less for this virus. So how accurate is that, or if this research is still pending, or they have to make some decisions on these?
Sure. So at best, it's a hypothesis. At worst, it's a myth. And I'll tell you why. You know, they say correlation is not causation. If I tell you that there are too many accidents during the month of January, car accidents, that does not mean that month of January has anything to do with it. Because when you look deep and you say, oh, actually it snows during the month of January and the roads are icy, and that is why we have more accidents. The causation is the ice on the road. The month of January is merely correlation. So what they've done is, and I also would like to push back on the point that these are robust scientific studies. They're not. I've seen them. They're basically maps and they're correlations. They look at, you know, all these countries that have BCG and look at their infection rate is low. The question they never tell you, how much ice is there? What I mean by that is all those countries have not done testing. And I know exactly the countries you're talking about. These are Asian countries and African countries. But when you try to look for how much tests they have done, you will not find that information. And that number varies between 100 to maybe 100,000 tests. I'll give you two examples. Iran used to do BCG, and Iran is heavily impacted. In England, BCG vaccine has been given since 1950s. They stopped it in 2005. Up until 2005 in London, in England, they were giving BCG in schools. England has 75,000 cases right now. So the only question I will ask people that first you do tests and you need to do, let me give you a comparison. So countries like, and Poland is another example. Poland used BCG. They have significant numbers, 40 million population, they have more than 5,000 cases of COVID. Pakistan, on the other hand, is a country of over 200 million population. but they also have less than 4,000 cases. That's not because BCG is protecting us. That's because we're not doing enough tests. So once you ramp up, Pakistan so far, by the way, have done about 200 tests per million. They need to do about 2,000 to 3,000 tests per million. So my projection is that if these countries, where they started using BCG, if they started increasing their testing by 10%, their number of cases are actually probably more than 10 times, not 10%. They need to increase their testing by 10 times. And the chances are that their total number of COVID cases are also 10 times of what they're measuring right now. I will always end with a caveat. I was saying earlier, nobody knows everything. Allah knows best. If I'm proven wrong and BCG truly has a good protective benefit, great. I'm happy to be proven wrong because it saves hundreds of thousands of millions of lives. But what if I'm right? Right? You can't make policy based on correlation. I think that's very dangerous. And once again, if you find a robust study, please send it to me, because I've been looking into this subject in my spare time and I have not found a robust study. I find correlations. Yes, here are the countries and somehow their rates are low. But when I ask them about testing, they're like, we don't know. That's not how you do science.
So next we'll come to the question from Sayyid Muhammad Ahmadi. I'm going to unmute you and you can ask your question.
Assalamu alaikum.
Wa alaikum assalam.
Okay, Jazakallah, Naib Ameer Sahib. And also my question is about the temperature. How the temperature can affect this virus? Like I heard somewhere or I studied that when it's getting to 25 degree, it will be, this virus will be die or it will be gone. Just if this is the case, and what's your recommendation? What should we do? Should we do like put our temperature in the house is also like an higher, or what's your recommendation? Jazakallah.
Excellent question. As of today, we don't think there is any correlation with temperature. So please don't make life harder for yourself. I don't think that it will make any difference, and here is why. If you look at the average temperatures in Florida or Arizona or California, they're actually pretty warm. If you look at the temperature in Brazil, it was pretty warm. When it started in January, it was summer in Australia. The temperatures in Singapore were pretty warm. So this virus is continuing to grow and spread in warmer states as we speak. The numbers in Florida and Arizona are not going down. So I would not, again, put all my eggs in the basket of temperature. Again, hope is a good thing. We must be hopeful. A mu'min never despairs. Allah Ta'ala, and that's a very important lesson. As I said, Allah Ta'ala says there is ease after hardship. That's the right position for us to take. Acknowledge that this is hardship. We don't have to say that, this is not hardship. But let's not pin our hopes on something that's not data-driven. Previous pandemics, whether they were H1N1 or SARS, which was also a coronavirus, they did not respect the weather. They kept on going for 12, 15, 16 months. So I think currently we don't think that weather is going to have any major impact. You keep your home temperatures to whatever is comfortable for you. More importantly, if you're married, your wife. That's more important. Whatever is comfortable for her, that should be the temperature in the house.
Next, come to a question from Naseem Kashif Sahib. Naseem, I'm going to unmute you.
Assalamu alaikum. I have a couple of questions. First one is, how long does this virus stays on your skin? And the second question again, would not we go out for the grocery whenever needed? So if there are so many people around you, but no one is coughing or sneezing around you, are there still chances of getting this virus by their breathing around you or something like that? And also when we bring the grocery at home, we normally wash it or wipe the packages and stuff. So if we don't do it anymore, like you said earlier, it is okay if you just bring the grocery at home. I just want to confirm again, like, should we keep wiping the packages, even the mail, and washing the food? And if we put some food in the fridge, does it still stay alive, or I don't know, if we keep it in the fridge for long, will it be there or will it be dead?
The answer to all of those questions is please don't worry about this. There is no science right now. I don't think you're putting yourself at risks. My worry is actually because I've heard people who are cleaning their groceries, who are cleaning the boxes, or cleaning a bell pepper with Lysol. I mean, you're adding more chemical and perhaps more poison to it by adding chemicals. The best thing is go shopping, follow the local laws. If your local laws say maintain social distance or don't go shopping during this time, don't go. Make sure you're following the local law. As far as you're outside and you're maintaining a 6 feet distance, you're safe. The air is not contaminated. When you go out and breathe, that air is pure. It is not going to make you sick. If you want to go for a run in your local park, do it. If you want to go and play basketball by yourself on the driveway, do it. Those are good things. There is no risk in my opinion. When you go out shopping, just do common sense approach, maintain 6 feet distance, bring your groceries home. Once all the groceries are in, wash your hands and say Alhamdulillah and move on. This reminds me that Khalid Misi Rabe in one of his sermons about Salat, he says a profound thing among many, many profound things. Hazur says every time we say Allahu Akbar, he says Allahu Akbar is like Qibla Numa, or it's like a compass to us. Our focus may go into different directions, but every time we say Allahu Akbar, we remember Allah is the greatest. So the science right now does not create any fear for us from these things. I think we have tied the camel's knee. हमने ऊंट का घुटना बांध दिया है. हमने अपनी जिम्मेदारी पूरी कर दी. After that, it's Allah. But you put your trust in Allah Ta'ala. I'm not saying we put blind trust in Allah and don't do our part. But at some stage, we have to put our trust in Allah Ta'ala. And I believe that is the right stage. Please do not worry about domestic surfaces. That's likely not where you're going to get it. I hope that this answers the question. I understand it generates a lot of anxiety. That's why it took a lot of time when I answered this question the first time. And I also know by now that some people, no matter what we say, they will still worry about it and they will still not do it. I respect that, sir. That's your choice. All I can tell you, I'm not doing it in my family. And I don't think that this is I don't think it adds safety for us, or I don't think that today the science recommends it. If tomorrow it changes, if we find new study, of course, I'll be right back telling you to change our position.
Next we'll come to Regional Qaid Sahib. Furqan bhai, I'm going to unmute you. Go ahead.
Jazakallah. Assalamu alaikum warahmatullah, Naib Ameer Sahib. My question is from a family member. So the question is that one of your recent tweets shared the news of successfully treating some COVID patients with the blood or plasma of COVID recovered patients. So two parts of the question. First one is, given that there have been a good number of recoveries so far, how is this mode of treatment going and why isn't it being used more often, or apparently not being used more often? The second part is, can the blood or plasma of a healthy person can be helpful in the current crisis somehow? Jazakallah.
So second part first, no, the blood of an uninfected regular person will not be helpful to a COVID person. But because of social distancing, there is significant decline in blood donations. So I do encourage everyone, and I know Majlis Khudam al-Ahmadiyya has put out some efforts along this line. I appreciate Sadr Sahib and the Majlis's efforts around humanitarian causes. So please encourage people to donate blood just in general because we have blood shortages, but it will not benefit COVID. As far as the plasma, convalescent plasma therapy is concerned, It is now happening in about 17 or 18 different states. I know for a fact it started in New York, in Houston, in my own system it has started. It is still promising, not proven. Realize that it has not been studied in randomized controlled trials before. We do feel it's promising because it's here and now rather than waiting for a vaccine a year or two. So how good will it be? How effective will it be for this particular virus? We will find out. But you're right, we were slow, a little slow perhaps, to get on it. But I think inshallah ta'ala, I'm seeing more and more people beginning to use it.
So next we'll come to the question from Abu Bakr Bhai. Abu Bakr Bhai, I'm going to unmute you and you can ask your question.
Assalamu alaikum warahmatullahi wabarakatuh, Sahib. Oh, Doctor. Anyway, my question is, because you touch on that part, which is the African countries or any other countries different from US.
One second. Is this Abu Bakr Sahib or Sergio Travel Sahib?
Sergio Travel Sahib, yeah.
All right, yes, sir.
With that, because I saw a lot of these social media videos coming from Africa, especially Mali, Senegal, Gambia. China has supplied them with these lot of materials, which including injections for this coronavirus. And the history or the video shows that those who were vaccinated, in 3 hours they are dead. What is your recommendation to tell our brothers down there?
Vaccinated by what?
About that supply of the supply came from China. They give them freely because they are undeveloped countries, so they give them freely. But there's a question there.
Jazakallah, I have not seen those videos. And so far, as I said, I'm quite in tune with the current literature. I think I'm trying my very best that every day I read for at least an hour or two during patients or at the end of my day. I have not come across any scientific literature to substantiate that. So right now, my advice would be, please make sure you get your information from cdc.gov. A lot of stuff that is floating on social media is either inaccurate or it's coming from what I call quacks who are not experts, or sometimes it's dated stuff. It's something that happened somewhere else 10 years ago and people are now using it to just generate, I don't know what their intentions are, but I would really suggest to not believe everything that you're seeing on social media. I have not heard any evidence of it. If there is a scientific study, you can always send it to me and I'm happy to look at it.
Next we'll come to Saad Bhai. Saad Bhai, I'm going to unmute your camera. I'm going to unmute you, sorry, not your camera.
Yeah.
Assalamu alaikum.
Wa alaikum assalam.
Assalamu alaikum, Naib Ameer Sahib. First of all, Jazakallah to Sadr Sahib and Najib Bhai and his team for this great initiative, mashallah. So my question is to Naib Ameer Sahib is, when can we say things are normal again? When there are no new cases, or when there is 1 to 10, 15 cases per day, or when we have created the vaccine for all the people worldwide? Thank you. Assalamu alaikum.
Smart question, and the answer was hidden in your question. You're right. So right now, I think there are different variables we will have to look for. In New York City, up until a week ago, there was 37% positivity, meaning that every 100 cases, every 100 tests they were doing, 37 were positive. So of course, that positivity has to go down, I would say, into single digits, number one. Number two, you start looking at newer cases. How many patients are we seeing? You look at the number of deaths. How many deaths are we having? So these are some of the factors that you look at before you say you have flattened the curve. And that's the thing. You look at the epidemiological curve, cases are going up, That's not the time to take your foot off the gas. At some stage, if you look at the curve of South Korea, for example, how they peaked and then they started going down. And once you go down to a reasonable number, you can then start opening up life again in a graduated fashion. You cannot just go cold turkey and then go full on again. I doubt it that that's going to happen. I think whenever life opens up again, this is just my own view, I feel there will be multiple modalities. First, people will be asked to wear masks. Second, there will be hand hygiene everywhere. Third, I think there will be social distancing. People will be, even in subways, you know, they will have 5 seats vacant and then person will be sitting here or there. So there will be structural changes to a society. I don't think the communal activity will start again anytime soon. As I said earlier, anything that generates and gathers a crowd will probably be prohibited until we get a good handle on it. I think air travel, international travel will remain somewhat restricted. At some stage, the antibody test or the serological test may become available. And then we will start seeing people who may be silently exposed or who may be milder or who we did not diagnose before, but we will start building up that number of those who are quote unquote immune. And this is, you know, it's a futuristic conversation, so Allah knows what happens best. You're asking me, I'm just giving you my professional input. That does not mean it's perfect or it's everlasting. I mean, nothing is everlasting beyond Allah Ta'ala. So another option is for cities like New York, for your business hubs, for travel, they may start asking for documentation that either you had the disease or you have antibodies, you know, show us the documentation that you're immune and then we will let you in. So there will be many, many objective ways that we have to look for before we say we can restart life again. I do understand that there's going to be increasing mounting pressure from businesses, from those people who are looking at the economy. So it's going to be a difficult balancing act. As Ahmadis, as good citizens, as our teaching has always been, my advice on this issue will be whenever that decision happens, that we remain calm and we support the government. Whether we like the government or not is a different issue. I think these are the times where we should support the government. If we have to express our dissent, we do it gracefully and we do it academically. We can attack the process, but we should not attack the person. So long answer, but it's a difficult issue. Nobody really knows, but those are some of the things in my mind that I think need to happen before life goes back to normal.
Next we'll come to a question from Faz Mirza Sahib. Faz bhai, I'm going to unmute you.
Assalamu alaikum. My question is more avoiding the physical aspect of the effects of coronavirus and moving more towards the mental and emotional aspect of it. I know with the quarantine in most states, people who have had a series of mental illness or have had history, this may be a aspect that hits a little bit harder. So my question is, how can those people and just anyone in general, like, help cope with whatever they are going through and help push forward? Obviously, prayers is one of the biggest one.
It's a very delicate question, and I appreciate that question. First of all, I think we must acknowledge and empathize, because we still are going through a cultural shift where we have different levels of understanding and acknowledgement of mental illnesses. So I think people who struggle with emotional issues or depression or anxiety or OCD or PTSD or even bipolar for that matter, first we need to have empathy. We should look at it like any other illness. That's the most important thing. And then the second thing is, of course, seek help, seek treatment. If you feel that this has impacted someone a little more harshly, seek professional help. As a community, like Hazrat Sahib has been saying, that this is the time for us to earn Allah's pleasure through istighfar and through helping others. And I must say that what Majlis Khudam Ahmadiyya is doing and what our National Amur-e-Amma department is doing. I cannot say how proud that makes me feel, because that's the true kernel of this Jamaat. What I'm seeing from Amur-e-Amma, perhaps a small team that typically there are a few people who are putting their blood and sweat and tears, and same thing from Khudam Ahmadiyya. You have no idea, the pride that I feel every time I see those messages and I hear from people, because this is the right direction. That there is an opportunity in every crisis. The opportunity for us is to serve others. If we have more, we share with those who have less. So similarly, on the emotional health, if Allah has blessed someone with more emotional health, I think it's important that we share that we meet our brothers, even through social distance like we're doing right now, be there for others, be a listening ear, be a helping hand. And let's just continue to remind each other that despair not. Despair is a bad thing. And if you have time these days, and many of us do, I would really encourage everyone here to read Surah Yusuf one more time. It's a beautiful story. Allah Ta'ala says this is one of the best stories. The story of Hazrat Yusuf and Hazrat Yaqub. The history books say Hazrat Yaqub probably waited 40 years for Hazrat Yusuf. I mean, he lost his beloved son, and we're talking of the end game. We're saying, how long will it take? It took 40 years for Hazrat Yaqub. And he says in that surah, he says, I despair not, because I know from Allah what you know not. So he is still hopeful after 40 years. For us, it has been less than 40 days. So I just want to make sure that all of us understand that we are never going to lose hope. We're not going to become despaired, and we're going to help each other.
Next, we'll come to the question from the person next up is kind of Halim Masood Saab. I'll unmute you and you can ask your question.
Assalamu alaikum, and I'm Risa. So my question, I apologize if the question is repetitive and has been answered before. My question is, we have heard like one patient, 102 years old, he was recovered from coronavirus in one country, and then there was 96 years old patient, 100 years old. And on the other hand, we've seen in the news like one health trainer, 36 years old, he couldn't survive. He had no condition before. There was one 42 years marathon runner. He was like perfectly okay health-wise, and he didn't have any issues, but he also couldn't survive. So I'm just trying to understand, is there a specific reason behind that? It doesn't seem like it's the immunity thing here, but is it like a virus can be deadly at one stage, it can attack someone and can be like mild for one? Jazakallah.
Appreciate the question, but understand the difference between data and outliers. There will always be outliers in life, but you can't generalize that, and that is not data. When we look at composite of large populations, even now, the younger people at far, far less risk than the older people. That's not to say that there will not be other factors. You will always see an occasional elderly person, or more elderly people getting better, and you will always see an occasional younger person succumb to it. That comes down to genetic heterogeneity. We don't know what other factors may be there. Like I have one of the patients recently, a young patient, who everyone was thinking, how did this young patient get this disease? But once we dug deeper into it, the gentleman was vaping. So now you're not a normal 35-year-old. If you're vaping, your lungs are already damaged. Now you get a viral infection on top of it. Yes, he bled all over in his lungs. So I think we're looking at outliers. I would not want you to worry about that. Don't let the outliers dominate your mind. Don't give them more space than what they deserve. If it's one dot, let it be one dot. These are not 1,000 data points.
Naib Ameer Sahib, it's 8:55 now. We have 50 questions remaining. So our ask was 9 o'clock, and you tell me how you're feeling. But I think it's fair to to stop soon.
So Sahib, that's your, you see there is a greater benefit that is coming out of it. You grab me by the neck right now. I'll stay, you keep going, because it'll be hard to get hold of me again.
Gee.
Same time, if you want to close it at 9 o'clock, I'm 100% okay with that. So I think we can very easily negotiate that one way or the other. I'm 100% okay.
So how about we take a few more questions and then we can wrap it up at around 9:15.
Yep.
Jazakallah.
Sounds good. So today we'll continue to move on to the next question. The next question comes from Munassar Alam Sahib. Munassar Sahib, I'm going to unmute you and you can ask your question.
Assalamu alaikum. I'm sorry to waste your time, but I forgot my question. I will raise my hand again when I remember.
All right.
Yeah, I think the lines are getting long, so people start to forget it toward the end. We'll come to the next question. Muhyiddin Saab, I'm going to unmute you and you can ask your question.
Assalamu alaikum. So the question I had, actually, there was an article published in New England Journal of Medicine recently, I think a couple of months back, about this virus surviving in plastic 72 hours and other surfaces lesser than that. I understand the fact that it's unlikely that over the days the number of virus particles would go down, and the likelihood of getting contracted the virus would go down as well. But saying that, I was going back to the previous conversation. I was thinking, is it still a safer choice to wipe off the surfaces regardless?
Yes, sir. It's always safe. You can do, as I keep saying, I know that study really well. Once again, that was a lab study where they churned up this virus, vortexed it, created an aerosolizing artificial situation. And the key word in that study is detected. The virus was detectable on the surfaces. And that's why I gave the example of dollar bills. That we can detect a lot of bacteria and viruses on our dollar bills, but they don't typically communicate or transmit the disease. I can never stop anyone from doing more. If you feel more comfortable cleaning, wiping, keep doing it. I've got no problem with that.
Next we'll come to Saud Iqbal. Saud bhai, I'm going to turn your video on and then unmute you. Okay, I guess not. Next question will come to Muhtamim Saab Mal. Yasir bhai, I'm going to unmute you and you can turn your video on.
All right. So my question is, so we are putting all our hope on the vaccine whenever it gets developed in 12 to 18 months, as they say. But we know that influenza changes, mutates every year, and sometimes the vaccine they prepare doesn't exactly match the virus that's in circulation. So if they develop a vaccine, what are the chances that this mutates and there's a new strain, and then the vaccine that they have developed doesn't work? And then how long, let's say when they find that out, how long will it take them from that point to develop the vaccine for the new strain?
Excellent question. So far, we don't think that the viral mutations will change anything for the vaccine, and here's why. This virus mutates many, many times. Actually, every time it goes from one person to the next, there is a possibility it may mutate a little bit, but those mutations are more clumsiness than anything else. In real life, if you truly study viruses, influenza is a very different case, by the way. Influenza is about antigenic shifts and drifts. It's a little bit more than mutations. Most of these mutations don't result in any change in the transmissibility of the virus or the lethality of the virus or the overall prognosis or the vaccine of the virus. In sci-fi and in Hollywood, yes, you have a mutation and you have X-Man or you have Spider-Man. In reality, in life, in viruses, these mutations are just an indication of how clumsy this virus is. And as of today, we do not think that these mutations will have a meaningful impact on that vaccine. So I wouldn't worry about it.
Next we'll come to a question. A lot of questions have come written in as well. I think in the last 10, 15 minutes, we should take some of those questions, if that's okay with you.
Sure.
So the first question the question says, when we return to normalcy, inshallah, what new steps should be taken at our mosques and salat centers in general to prevent generalized spread of such viral infections? For example, presence of hand sanitizer, frequent vacuum and cleaning of carpets. Should anyone with simple cold or flu symptoms wear a mask? And what does the post-COVID new normal in society look like?
I think we've discussed this many times before today. I will say the same things. At some stage, this will become a part of our flora. H1N1, the Spanish flu outbreak 100 years ago was actually influenza H1N1. And then H1N1 in 2009. And even today, we see H1N1. So what happens is I wouldn't expect this virus to completely go away. It will sort of become a part of the flora, but more and more people in the community will develop immunity to it. We'll figure it out, as they say. You know, you have a new quarterback who also throws the ball and runs the ball. The first few games you can win, but at some stage you get figured out. And people put enough defense on you that you can't do the same thing over and over again. So I think we as the scientific community are working pretty hard to try to figure this virus out. What that new normal will look like at some stage, I think it'll go back to pretty much how things were. Whether it'll take a year or 5 years, I don't know. But I don't foresee people wearing masks forever. I don't foresee hand sanitizers everywhere. Yes, it'll increase, you know, our sensitivity to it will increase. But human beings are tough and complex machines. They tend to gravitate towards normality. So I don't know if it'll change everyone forever, as some people hope and expect. Yes, the smart people will take their lessons and they will change themselves. The real change comes here in me, in you. And that change could be medical, that change could be spiritual, that change could be academic. And that's what I would focus people on. How those mechanical things look, that's an easy part and will be figured out very quickly when the time is right.
I'm not sure if you're talking about Lamar Jackson as the quarterback they're figuring out next season.
Oh, sir, that's my favorite quarterback. I was thinking someone else. I knew you would, you know, come on. You are close to Baltimore. Why are you trying to get in trouble with himself?
That's your question.
Don't say anything to our Lamar.
We have the social distance to protect us. The next question comes, should I wear a mask when going for a walk even if no one is around?
No, sir, don't do it. You're fine.
We'll go to the next question. They ask, is it fact or myth about ibuprofen?
I think it's largely myth. It is myth.
Jazakallah. Next question is, if you can kindly relate to, sorry, that was the write-up. When would you anticipate, given what we are hearing from Dr. Fauci in the White House press briefing, the timeline on what the social distancing measures should be lifted, and to some extent?
As I said, we've discussed it before. I think we have to look at metrics. This cannot be just done because we are sick and tired of it. An intelligent thing will be to see the case positivity rate, the fatality rate, the overall spread between states, and then global spread. And then you'll have to do it piecemeal, where essentials will start first, then less critical businesses will be open. Then at some stage you may open travel, at some stage you may open public gatherings, and in some states sooner than other. And then at some stage you may measure antibody levels and see how many people are now immune to it. So it depends on a lot of factors and a lot of objective factors. Right now we're still struggling with having enough tests and enough antibody tests. So as our capacity improves and we can get more meaningful data, I think we'll be able to make more meaningful decisions.
The next question comes, it comes about a low-grade fever over multiple days. If someone, I'm assuming they're asking, if someone has a low-grade fever over 8 days specifically, what precautions should the person take?
Again, very hard for me to give you individual advice because there could be so many reasons for that fever, but assuming that if it's COVID, I would say 2 weeks of quarantine, you stay in a private room, you use a private bathroom, don't go out and meet your family members. If you must go out, wear a mask, stay 6 feet away, and must call your doctor.
The next question is, some people in Pakistan are saying that use of ginger and onion is effective in this virus. Please advise. I think this is maybe an underlying WhatsApp question.
I love those people in Pakistan, but I disagree with it. I don't think there is any scientific basis for
it. Someone else is asking in regards to the comparable diseases to this, are there any that come to mind?
Influenza, SARS, and Middle Eastern Respiratory Syndrome.
Another question says that on the khutbah 4-3, Hazur Anwar said that mentioned incense sticks. Any advice on what type of incense should we use?
No, I don't think there is any specific type that's better than the other. So whatever you like.
Next question comes, how do we convince elders who think this is all hocus pocus and isn't taking precautionary measures?
Say that again?
The question is, how do we convince elders who think this is all hocus pocus and isn't taking precautionary measures?
Elders, this is a difficult one. I think the best thing is, first of all, don't raise your voice. I think it's very important. Sometimes tone matters more than substance. And realize one day we're going to get there. So that's the first thing. No matter what the conditions are, it's important to give them the due respect, because in many cases we're here because of them. That's not to say that we agree with incorrect information. And in our culture, there are just so many mixes here, so many things that get mixed here. Sometimes, we are convinced deep down, but we're just saying something for the purpose of a conversation. Sometimes we just think it's funny while it's not funny. It's just very complex. So I'd say continue to share data, continue to have a conversation. Don't take things personally. People have, no matter what the conditions are, people still have a right to their opinion. We can disagree with their opinion. Yes, if they're putting someone's life at risk, it gets very difficult. In those situations, just wasta'inu bis-sabri was-salah. At some stage, you do whatever you can, but then you seek help with was-sabri was-salah. There's a key there. Sabr first and prayer next. First thing is patience. Second thing is prayer. So, as I said earlier, there are many opportunities in every crisis. Maybe that is our opportunity to be more patient with those hard to understand, hard to rationalize situations.
So the next question comes. They said that my question is that my wife's due date is April 18th. Is hospital safe for doctor visits and for mother and newborn?
Excellent question. So the short answer is yes. The long answer is the previous infections, whether it was H1N1 or SARS or Zika, we know they had a higher risk for the mom and the child. All the initial data suggests that there is no higher risk for the mother. There's no higher risk for the baby. We have not found this virus in the breast milk or in the placenta. We have not seen increased number of intrauterine complications or post-delivery deaths. We have not seen as much maternal complications. And recently, the new guidelines are that any time expecting mom will come to the hospital, she'll get tested for coronavirus, whether she's symptomatic or not. So inshallah ta'ala, may Allah ta'ala bless you with a healthy child. May Allah ta'ala protect your family. But I think hospitals are safe. We have made adequate system improvements, and be prepared. Your wife will likely get tested for coronavirus. So I have no concerns there.
Next question comes. I run a home daycare and am open for essential employees. Are children under 5 a big risk of carrier?
Certainly possible. We don't know that answer unless we do mass testing, but it's certainly possible.
Another question comes in. When somebody in your family does have coronavirus, what cautions can you take to keep the rest of the family safe?
Again, for 2 weeks, let that family member stay in a private room, use a private bathroom, give them food in their room, let them change in their room, and give them adequate social support through FaceTime and other ways to make sure they're not lonely. But once they're fever-free for at least 3 days without taking any medications like Motrin and Tylenol, and once they're at least 10 days away from the onset of their symptoms, they should not be as communicable. So from that standpoint on, you can restart life.
Jazakallah. I feel like now we're in a rapid fire round. But no, Jazakallah so much for doing this. The next question comes in that asks, is the virus airborne?
No. So I know that there are, people will again quote that study from New England Journal of Medicine that proved that it could aerosolize. The example I give you is an eagle can fly and a hen can fly. This virus is a hen, it's not an eagle, which means it can stay in the air for a little while, but then the droplets will land. It cannot go long distance in the air. So droplet contamination, yes, it can remain suspended depending upon the size. It's less than 0.2 micrometers in size. It can stay in droplets. But just like a hen can fly only a few feet and then will fall again, a hen can cross a small canal, but it cannot go a distance like an eagle. So there are other viruses that are airborne, like measles, for example, but this one is not. And I don't want people to think that way.
The next question comes, I assume that the question is asking about when we're going to go back. The question asks, is it possible to go back to normal? But I'm assuming the question is asking more so, when will we go back to normal? And what impact do you think this will have on American businesses?
It will have significant negative impact. I think we all know that. The rest we have already discussed. But I think it's important to realize that money can be recovered. Human life cannot be recovered. So we must continue to focus on preserving human life, because if we don't do that, we're not going to be able to regain the trust of the end user or the customer or whatever drives the economy. So we must understand that sequence. That Bill Gates said it best. He said it's very hard to tell people, go shopping, go flying, just ignore that heap of bodies on the side. I mean, it's not easy to tell people to ignore human suffering.
Exactly. Maybe we can take this as this last question. The question asks, should we follow the social distance at home? I think that's in regards to with family members.
I don't think so. If there is no one sick at home, you've been living together. I don't want people to become paranoid. Currently, CDC does not recommend that, to the best of my knowledge.
Exactly, Ameer. So I think we can hand it back over to Sahib, and Sahib, you can go ahead.
Naib Ameer Sahib, Jazakallah. Ji, go ahead.
A couple of things.
Sure, absolutely, Ji.
Just first of all, I wanted to appreciate what Majlis Khuddam al-Ahmadiyya is doing. I think you're doing a fantastic job. My son educated me about how the last week went. I'm very, very excited and happy about it. May Allah Ta'ala bless you for doing all the wonderful work you're doing. Number two, that this is an ever-changing situation. If information changes a week from now, a month from now, we should remain open to that. It's all right. Nothing is a final word. We're just trying to give each other true information and balanced information that does not create panic and does not keep us in denial either. And number three, I think there is an opportunity in this crisis. My request is for all the youth to, if not before, please continue to make sure that you listen or read Hazrat Saab's sermons and truly try to understand where he's taking us. Because you will see that there is a lot of discord and disagreement in every level of government in every country. And we are blessed that we have a spiritual leader where we can build that agreement, where we have this brotherhood, where we have this trustworthy relationship across countries, across races, across generations. It's unbelievably rare. I cannot tell you what amazing opportunity we have as a global institution. So please continue to think about that and make sure that you find your own opportunity in this crisis. If we come out of this not learning anything on a personal level, I think that to me is more damaging than the virus. So please make sure that we have some action items out of it for ourselves. Jazakallah for the opportunity again. So over to you, sir.
Jazakallah, Naib Ameer Sahib. I really appreciate the time that you took out of your busy schedule to join us, to answer our questions. We still have lots of questions, but unfortunately not enough time to answer all of the questions. But Jazakallah, really appreciate the time.
Thank you.
There's a brief presentation by Motamim Malsab, but Naib Ameer Sahib, you're welcome to sign off now.
Thank you, sir.
Thank you so much.
Assalamu
I'll turn it over to Motamim Malsab.
Yes, but you're muted.
Oh, okay. All right. Assalamu alaikum, Sahib. It's hard to go really after Naib Ameer Sahib. I'm not known to be a great speaker, but I think there's a lot of anxiety and fear right now. And I thought I would say a few things that might, the solutions really, it's not me saying, but the solutions that are presented by Quran to ease those fears that we all have. So I'm going to share my screen. I hope it works. Let's see. All right, here we go. Okay. Is it working?
Yes,
can you guys see my screen? Okay. All right. So I was looking for some verses from the Holy Quran. So I came upon this. Actually, I was thinking that I would present like a set of verses from here and there, but really this about 10 or 11 verses in Surah Al-Baqarah just perfectly describe the situation that we find ourselves in, and you know what we have to do, and the fear and anxiety that all of us have, that I talked about. You know, some of us we have already lost our jobs. Some you may not have lost jobs, but you might have, your hours might have been cut back, or part of your income might have been reduced. Others, it might not have happened yet, but you might be thinking that, okay, you know, probably, okay, my company, you know, how long can they survive in this situation? Maybe they'll lay me off. I'll lose my jobs. What will happen? Maybe I will not get my bonus that I was expecting. My income will be reduced. So what, you know, all these fears, and a lot of us are doing, you know, things to prepare for that. You know, you might be saving money, putting it in the bank, cutting back on expenses. So those are all good things which everybody should be doing, because Allah Ta'ala tells us, you know, even like, for example, when we talk about COVID, you know, you do all the physical things that you need to do, you know, staying away from people, washing your hands and all that. But then Huzur advised us, you know, ultimately, when it comes to, you know, the real protection, that comes from Allah, and you rely on prayer. So similarly, in this situation, all that is good, cutting back expenses, saving money, all that is good. But what we have also seen some people are doing, and National Secretary Mal Sahib for Jamaat, Tala Chaudhry Sahib also sent an email that we have seen quite a few people cutting back on Chanda. And that's where I wanted to present these verses and see what kind of solutions that Allah has told us, and you know what assurances that He has given us regarding that. So I'll just go over verse by verse, and I'll highlight a few points from each of the verse. So this is Surah Al-Baqarah, verse 262. So in the interest of time, I'll just focus on the translation. So the similitude of those who spend their wealth for the cause of Allah is like the similitude of a grain of corn, which grows 7 years, and each year 100 grains. And Allah multiplies it further, and Allah is bountiful and all-knowing. So I'll focus on this part that, you know, Allah multiplies it further. So, you know, in this verse, Allah has promised us that if you spend your money in my way, He will multiply it manifold. And He's the one who is the bountiful. You know, He's the one who's, you know, in this word, wase, right? He can increase it. So, you know, you in the worldly sense, if you go to some investment advisor, you try to invest money, they all have these disclaimers saying, okay, you know, all investments carries risk. You might lose your principal, all that. But this is investment advisor here who's giving a guarantee that he'll multiply your wealth. And there's no disclaimer. There's no, you know, if, but, anything like that, right? So that's, you know, Allah promising us in the Holy Quran that if we spend in His way, then He will multiply our wealth. So I'll move on to the next verse. And they spend their wealth for the cause of Allah, and then they follow not up with what they have spent with taunt or injury. For them is the reward with their Lord, and they shall have no fear, and they shall not grieve. So again, I'm going to focus on this part. They shall have no fear, and they shall not grieve. So again, as I said in the beginning, there's right now a lot of fear, a lot of anxiety. But what is the solution? And the solution is given to us by Allah Ta'ala, that if you spend in His way, then you shall have no fear and you shall not grieve. And in fact, we should have been spending, giving chanda and all those other charitable things before the crisis hit, because when the crisis hits, then everybody becomes scared and starts to remember Allah. But there's a hadith of Holy Prophet ﷺ that I also shared a few days ago, that spend in the way of Allah in good times, and Allah will remember you in the bad times, right? When the times are hard. So that was the time really, but to spend in the way of Allah. But still, Allah doesn't let any good deed go to waste. So even if you haven't spent it, you didn't spend it previously, or didn't spend it as much as you should have, now is still the time. So moving on, a kind word and forgiveness are better than charity followed by injury, and Allah is self-sufficient and forbearing. So in this verse, I'm going to focus on this word, self-sufficient, and then the word in Arabic, ghani, that, who is the real person or being who is the self-sufficient. We are all think ourselves that, okay, I'm going to save some money, I'll put some money in the bank, I'll cut back on expenses, and then somehow I'll get through this crisis. But Allah is telling us here that it is only Allah who is, in the real sense, is self-sufficient. You might do whatever you want to do. You might save a few $100 there, $1,000 there, and you might do your own thing. But really, the only person or the only being that is self-sufficient is Allah. He's the one who's ghani. And all your little schemes can be brought to nothing if He wants to. So USA, one of the richest countries, the mightiest power, its economy has been brought down to its knees by the tiniest of the creatures. And I don't know if you guys hear the press conference of President Trump every day, and the phrase that he uses the most often is, nobody could have ever thought that this could happen, right? But Allah, He has His ways. So, He brought down the biggest economy, the mightiest superpower, by the very tiniest, like nothing is like smaller creature than that, right? A virus. It's barely alive, but it was able to bring down the biggest economy. So if you think that you have, USA is spending trillions of dollars now trying to get out of this, and you are trying to save a few $100 here, $1,000 there, and think that you will be sufficient for yourself, then that's as I say, it's a fool's errand. Basically, Allah is the one who is the self-sufficient, and if you don't put your trust in Allah, then all your plans, everything can just go to waste. So I'm going to move on to the next verse. O you who believe, render not vain your alms by taunt and injury, and like him who spent his wealth to be seen of men, and he believes not in Allah in the last day. And his case is like the cast of a smooth rock covered with earth, on which heavy rain falls, leaving it bare and smooth and hard. They shall not secure aught of what they earn, and Allah guides not the disbelieving people. So again, continuing on the same theme that, trust in Allah, I'm going to focus on this part. And he believes not in Allah. So, we all say that we believe in Allah, but do we really put it to practice? Do we believe His words? In the Holy Quran, He has promised that He will, if you spend in His cause, then you will not be, at a loss. He will return that money many times over. But at the same time, when we get into this financial distress, or we are worried about money, then we say, okay, we're going to try to save some money, cut back on chanda, and somehow when we are out of this crisis, then we'll give it to Allah. But really, what you are showing from your action is that you do not believe in Allah. Because if you had believed in Allah, then you would have spent that money as Allah demands you to. So that's the part I want to focus on this verse. Moving on, next verse. And the case of those who spend their wealth to seek the pleasure of Allah and to strengthen their souls is like the case of a garden on the elevated ground. Heavy rains falls on it so that it brings forth its fruit twofold. And if heavy rain does not fall on it, the light rain suffices, and Allah sees what you do. Okay, let's focus on this part. Sometimes Allah literally multiplies our money. We get many times. There's, Huzur, if you listen to his speeches, describe all these, incidents that people write to him about from all over the world, where somebody gives some chanda and, gets much more in return. But sometimes, you don't really see much more in your bank account. Your bank account might be the same or might even reduce, but you're much more content even with less. So Allah has ways of providing for you from other means, which might not be physical money, but He has a way of providing, and that even that small amount, as Allah says, it will suffice for you. And the last part, that Allah sees what you do. So that's also very important. You might want to try, to be clever, as some people try to be, and say, okay, my Nazima is asking me, or my secretary finance is asking me about chanda, I'll just give half of what I owe, or give a smaller amount. But Allah is really saying, He sees what you do. He is the Razak. He is the one who provides for everything. So He sees what you do. So you might have your own plans. You might try to be clever, but Allah is the one who sees what you do. Moving on. Does any of you desire that there should be for him a garden of palm trees and vines with streams flowing beneath it, and with all kinds of fruit from him therein? And when the old age has stricken him, and he has a weak offspring, and then a fiery whirlwind should smite it, and it be all burnt. Does Allah make His signs clear to you? You may ponder. So again, same thing. You might have your own plans, your schemes of saving money, and trying to avoid paying chanda, but Allah has His own plans, and He gives a simile of this garden that somebody has planted, and He's putting His trust in that garden. But ultimately, at old age, it gets all burnt to ground, and that's what for example, President Trump. His big thing was that he has the best economy, and he was basing his election on that good economy. But within few weeks, all the plans, everything, Allah eliminated all that with the virus, right? So if Allah can do that to the U.S., to much bigger powers than you, then He can do that to you. So again, putting the trust in Allah, that's the real thing. So then next verse, O you who believe, spend the good things that you have earned and what we produce from you from the earth, and seek not what is bad to spend out of it. And when you would not take it for yourself, except that you connive at it. And Allah knows, and know that Allah is self-sufficient and praiseworthy. So I'm gonna focus on, spending the good things and not spending the bad things, right? So what is spending good? In another place in Holy Quran, Allah says that never shall you attain righteousness unless you spend out of what you love, right? So, when you eat some food and there's some leftover, and you throw it away, or you give it to someone, or you wear clothes, and when they're all done, you try to donate it. That's what is leftover. That's not what's good. So when a lot of people, what they do is all year, they're not going to give any chanda. People keep reminding them they won't give any chanda, but come September, October, for Qudam chanda, then they will pay it, right? So that's not really, that doesn't really show what you're spending out of what you love, right? Because all year you loved that money and you held onto it, and then at the end, just before the deadline, you paid it. So if you were willing to spend it and spend it now when you're in tough financial times, and you might want to hoard that money at this time, but when you spend it, then you really show that you don't love the money, you love Allah. So don't treat Allah like leftovers, right? Don't give Him the leftovers, give Him the good thing. As Allah says, spend of the good things. So spend it now, and don't say, okay, when this financial crisis will be over, then I'll have some money, I'll give it to chanda, but right now let me just keep it for myself. Moving on, Satan threatens you with poverty and enjoins upon you what is foul, whereas Allah promises you forgiveness for Himself and bounty. And Allah is bountiful and all-knowing. So again, this fear of poverty that prevents us from spending the money. So Allah says, don't worry about that. I'm the one who is bountiful. I'm the one who's going to increase your wealth, nothing else. And Satan is the one who's telling you that, hide that income. Don't give the pledge that is accurate according to your income, and what you should be doing. Moving on. He grants wisdom to whom he pleases, and whoever is granted wisdom has indeed been granted abundant good, and none would be reminded except those endowed with understanding. And whatsoever you spend, or whatsoever vow you vow, Allah surely knows it. It is, and for the wrongdoers there shall be no helpers. Right. So whatever you spend, Allah knows. Allah knows what He gave you. Allah knows what you spent. There's nothing hidden from Him. I'm going to move on to the last verse. Right. So I'm gonna cut this off here. But basically, Allah is, in the last verse it says, "And whatever of your wealth you spend, it shall be paid back to you in full, and you shall not be wrong." So this is the guarantee from Allah. This is not me saying. This is not some other person saying. Allah has said that whatever of wealth you spend, it shall be paid back to you in full. That's the biggest guarantee you can have. If you put your trust in Allah, you trust His word, then that's what you should follow. I'm gonna quote from from the Promised Messiah. This quote. Let me try to make it a little bigger. Okay. All right. And I wrote down a rough translation of it. This was in Urdu. So let me put up this in Urdu, and then I'll try to read, just to save time, I'll try to read the English that I have on the side. Here. Okay. So Promised Messiah says, and this is from a khutbah of Huzur that I recommended. This is from 2008, just before the financial crisis. So I was reading it, and I really recommend that you go ahead and read it. Has a lot of wisdom, especially before the last financial crisis. And Huzur was talking about the US and how US is very proud of its economy and all that. And this is from June, so within 2-3 months in September, October, that financial crisis hit. So I do recommend this, June 6th of 2008. So Promised Messiah says that when people cross the limits and put all their trust on the physical means and put all his efforts towards that, towards the physical means, then that is shirk, associating partners with Allah. That throws him away from the real purpose. For example, if someone says that I did not have those means, I would have died from hunger. Or if I did not have that property, I would have felt some pain, or I would have suffered. Or if I did not have friend, it would have been painful. Allah does not like this, and that you should put all your trust in property or those means or friends, or move away from those from Allah completely. This is dangerous, shirk, which is completely against the teachings of the Holy Quran. Allah says in the Holy Quran, "And heaven is your sustenance, and also that which you are promised." This is from chapter 51, verse 23. "And he who puts his trust in Allah, he is sufficient for him." Surah Al-Talaq, verse number 4. And he says, "And he who fears Allah, he will make for him a way out, and will provide for him from where he expects not." So again, really important you're not even expecting income from a source, but Allah will provide you income or sustenance from a source that you're not even expecting. This is also from Surah Al-Talaq, verse number 3 and 4. And finally, from Surah Al-Araf, verse 197, "And he protects the righteous." And Prophet further says, "The Holy Quran is full of such verses where Allah is the guardian and provider of the one who are righteous." So when someone relies on these means, then he denies the attributes of Allah, and he gives a part of the attributes of Allah to these physical means. Since he leans towards these measures, so he takes a step towards shirk, that is associating partners with Allah. Those who are inclined towards the government officials and get some reward or title from them, then he develops some kind of respect for them, and in his heart, just like the respect of God, then he falls in love. Actually, let me just, for those who are reading, will do. He falls in love with those government officials or some other means. And this leads to degradation of Tawheed, Tawheed meaning the unity of Allah, and he moves away from his real goal. Thus, the prophets have advised that one should not confuse the physical means and the Tawheed or unity of Allah, and keep each one of this should be kept in its own place. All the means should lead you to Tawheed. So the physical means, they have its own place, but then the unity of Allah, they have its own place, and one should lead you to other, not replace the other. They want to teach us that all honors, all comforts, and the provider of all our needs is God. Therefore, if anything else is made to be equal to him, then it is obvious one of these will overcome the other. Therefore, the unity of Allah should be the one which should come on top. One should not acquire the means, but one should acquire the means, but means should not be made God. Due to this unity, one develops love of Allah, and when one realizes that the profit and loss in his hands, meaning Allah's hands, then he's the one who really loves you. Every minute, every minute thing belongs to him. Then there's nothing else that can come in between him and Allah. When someone attains this pious state, then he is the one who is called a Unitarian, or the one who is a Mohid, or one who believes in Tawheed. Thus, one part of Tawheed is that one should not worship stones or other humans, and does not make anything else equal to God. Instead, he should hate it and should show impatience with other conditions with other things, and one should not rely on physical means. So that was basically my saying that, chanda is very important, whether it be Jamaat chanda, chanda aam, chanda jalsa salana, chanda wasiyat that you need to pay, and that deadline is coming up, or khudam chanda. Many of us have not really given our pledge so far for this current fiscal year. At least half of the khudam have not given their pledge. So if you're seeing on my screen and you're on your computer, what I recommend you to go is to chanda.mkusa.org. Go to this page. There's a button called Submit Budget. Click on that. And if you don't remember whether you submitted your budget or not submitted your budget, I recommend that you do submit it again. And if it's a duplicate budget, we'll just take the latest value that you submit for your budget, and just be honest according to your income, as I explained already. Don't need to go over it. It's a short form, just will take you 7-8 fields. Your member code, if you don't know, you can leave it blank. Name, majlis, email address. We're not asking for income, but if you enter some income, it will try to calculate your. So if I entered, $500, it'll say, okay, 41,379 is your income. Is that correct? And then you verify, okay, this is the correct income. If you cannot afford according to your income, there's an option to request for remission, and so Sahib will get that request, and he approves all the requests. There's no denial. But you honestly say, okay, I cannot pay, according to my income, $500, 41,379 is my income. I cannot pay $500. You request and you give a reason, and we will allow you to pay less, but your pledge should not be, and then you specify what you can pay down here, right? But you should not lie, as already explained in all the verses that I read. You should not lie based on your income, that, I earn less. Don't put in here $500 if your income is, $100,000, right? So just be honest. And if you can't pay according to your income, then explain why you can't pay, and then that request will be approved. So first of all, do submit your budget. Next thing, if you haven't paid this year's chanda, go ahead, pay my chanda. Now with the physical distancing and everything, we're not collecting cash, we're not collecting checks. Just pay online. One-time payment or recurring payment, I recommend you set up recurring payment. You can say myself. Really recommend bank account, best option, because that's very minimal fees, only 6 cents. So if you give your routing number and your checking account number that's on your check, select that, fill it out, submit it, and you can select a schedule, start date, end date, how frequent you want it, twice a week, twice a month, monthly, quarterly. Select that amount, submit it, take care of your chanda, and I'm gonna end here. Jazakallah. I think I went over time.
Jazakallah, Muhtaram Sahib. Jazakallah to everyone who stayed. I will ask Muhtaram Talim Sahib if you have any announcements before we end.
Jesus, I have just a couple quick announcements. I'll make them quick. I know everybody's been here for a while. Just give me 1 second. Yes, but if you just unshare your screen.
How do I do that? That's what I'm trying to see.
Where's the middle
Maybe I
option?
just quit. I'll go probably end. I'm gonna quit, but I'll get your announcements. All right. Assalamu alaikum.
So Jazakallah to everybody who stayed. Alhamdulillah, it was a really fantastic session. I wish we could, Naib Sahib was still here so we could thank him again, but Jazakallah to everybody for attending the session as well. Tomorrow, inshallah, will be the concluding session of MK Connects. One piece of advice that we're giving now to the Majlis is that, again, there are a limited number of seats for the session tomorrow. And so it is our advice to everybody that you should try to enter before 2:45. We'll have opened up the session, especially for all Khuddam brothers. Again, we can't regulate who's coming in and who's not in terms of non-Khuddam brothers. So again, our recommendation is that please try to come as early as possible. We want the 1,000 to be Khuddam, but the only way we can do that is Khuddam come early. So again, please try to come and enter the room by 2:45 tomorrow. So inshallah, you can attend the session with respect to Naib Ameer Sahib. With respect to Ameer Sahib. The other announcement I have is that it will be a question and answer session with Ameer Sahib. So please take time tonight and tomorrow to think about your questions and have your questions ready to go for Ameer Sahib. Alhamdulillah, Ameer Sahib is graced us with his presence and he'll grace us for a question and answer session. So please think about your questions beforehand and have them ready to go. I just want to give an apology to anybody who raised their hand today and I missed you, or if you sent in your question and I missed you, I apologize. A lot of questions were coming in. A lot of people had their hands up and I apologize for the long waits. But alhamdulillah, I think this session was very rewarding. Jazakallah to everybody for attending, and let's not make any closing remarks and we can inshallah end.
Jazakallah. No, really appreciate everyone staying. Inshallah, see all of you tomorrow. Jazakumullah. Assalamu alaikum wa rahmatullah.